Coming up, Gayle King's exclusive interview with Facebook's Mark Zuckerberg about the social media giant's new election security measures. Plus, meet a group of teenagers bringing fresh food and hope to their community. Coming up on CBS This Morning.
We got your 6
at 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
Così uli di sombranza e zuita saluda antes di niga radzaudzan malakes frezas durante todo memu a nogi distancia gumugupugi palu zangiman malak guafi con una sughiairi preba tu la noci nai banderata gaigi pues atan fanni bandera kau esta pagua pumalapa giluk tanu man libri sentami ti man ko badi.
Ibandera,
right, let's go. Good morning, Guam. Fitness Friday. Whoa. Good morning, Sabrina.
Good morning, everybody.
Good morning to Astumbo. Derido is here.
Let's go, Jay. Let's go.
Good morning to Astumbo. Derido is here. We see them watching.
Good morning to Guam. There, I just
That covers everything.
Nice. Hey,
Yeah.
In one sentence, you got 30 miles long by 7 miles wide.
Yeah.
Nicely done.
How about Tinian? Good morning, Cocos Island.
Hey.
Good morning, CNMI.
Good morning, Barragata. Let's get specific here. As Barragata's checked in this morning.
Is that Ledzang or radio?
Kenyatta.
Oh, nice. Okay. Good morning to Hyundai down in Santa Rita. I got lots of friends there.
Good morning, San Diego and Las Vegas.
Good morning, Kansas.
Good morning. Oh, go ahead. Good morning, Federal Way, Washington, former home of the champ, Rocky Martinez. Rocky stayed there for a while.
Right. And while we're in Washington, let's shout out to all our Chamorros in Lacey and Port Orchard.
Oh, yeah.
Good morning, California. We got somebody coming on today from Cali.
Bear, this guy, Show Your Old Man. I remember when Bear hosted me. I went out to San Diego. Man, I forget when, but we did something and it was cool. The guy's got the Show Your Old thing, and well, he's got his Zori on the ground in California, and I'm looking forward to that, Bree, because I feel like there's like two Californias. On some of my friends who were in Cali, they see him going around with a mask, and it kind of almost looks like Guam. But then some of my other friends in like San Diego, it's like, whoa, do they even have COVID?
Hey, can I just say good
And
morning?
He's a really humble guy.
Yeah.
So
Not a nicer guy on the planet.
Yeah.
Super, super cool.
Yeah, and I mean, Show Your Roll goes back. That was one of the first local brands, and like you said, Bear, super humble. He was out here a couple years ago for the Three Chiefs beer thing.
and he was here to host a friendship jiu-jitsu tournament.
Right. So we'll talk with Bear and man, the show guys today, as we're anticipating some very big announcements. So this morning with the governor's press conference at 11. Thank you for joining us on the link. It's the Breeze 93.9 at 6:20. It's proudly brought to you by Calvo Enterprises, First Hawaiian Bank, and IT&E. We'll just run through the guests this morning, Bree. We'll start it off after the news. Bring on Dr. Peter Lombard, who's going to be crunching COVID stats. He does the projections, the charts, and all that complicated stuff. So we'll talk with him. And then there was a statement kind of out of Adelup yesterday about what the governor is inclined to do.
Right.
This morning. Mm-hmm. And spoiler alert, she's inclined to extend the PCOR 1 lockdown. So, we asked the governor all week to come on the show, and I know she's busy, so we're getting Crystal Pacos and Augustine. Then we'll break bread again with our man on the Physicians Advisory Group. He's the chair, Dr. Ho Wen, and we'll get public health on. Always important to have the public health presence during a public health emergency. And so, again, we'll have a couple of our regulars on, Annette Huggan of the Public Health Contact Tracing Team, and Dr. Ann Pobutsky, the Territorial Epidemiologist. And then we'll do our mayors again, guys. So if you're from Barragata, Mangwang Totumaiti, Jigo, Jotnya, Mayor Kev, they got caught in the flash flood. So I know he's kind of, it was funny because he's like, man, boy, not boy, but he's like, man, I have a runny nose and a cough, but it's not COVID. So we put the invite into him, and hopefully he'll be able to join us on that Zoom. Sergeant Paul Tapau, the Guam Police Department, and then we'll go behind bars with Major Anton Huggan of the Department of Corrections. And we'll close it out with Vince Bear Kittigwa of Show Your Roll. That's all coming up on the link. It is the Breeze 93.9. Let's go ahead and do our link update from the KUAM News team. Good morning, Guam.
All right, everybody, here's what's happening this morning. When it comes to any emergency response, firefighters are the first on the scene. And when it comes to combating coronavirus, GFD is truly on the front line. And with 2 positive cases at the agency, they're doing what they always do, pushing forward and continuing the fight.
2 cases of the coronavirus hitting too close to home.
We're brothers and sisters out there on the field. We are family. And we have to take care of our family as much as we can.
Within 24 hours of each other, 2 firefighters tested positive for COVID-19. According to GFD spokesperson Kevin Riley, it was on Sunday a firefighter at the Tumuning Fire Station reported feeling ill and was secured for duty. He tested positive on Monday and is in home isolation.
He was on duty all day. In the evening, he started exhibiting, when the guys are going around making their rounds, doing our wellness checks. is when they said, that he claimed to be feeling ill.
It was also on Monday a firefighter assigned to the Dededo fire station called in sick after exhibiting symptoms. He was tested and on Tuesday was confirmed positive for COVID. He is also on home isolation. All firefighters at Tamuning and Dededo who were on shift with the positive cases will be tested on Friday and Saturday. As for close contacts and the need for quarantine, Riley says there were no close contacts at Tamuning, but Dededo is a different story.
At the Tamuning fire station, we do have an engine company and we have a medic unit. So together, 6 people within that station. So separation and segregation to maintain our proper social distancing is fairly easy there. However, when you move into Dededo fire station, you have an engine company, you have a medic unit, but you also have a rescue unit there too. So that adds another 3 to 4 personnel a day. As you know, at the fire stations, we live together, we sleep together, we eat together. So they met the close contact criteria at the Dededo fire station, but in the Tamuning fire station, the personnel there didn't meet it.
All those who were on duty at the Dededo fire station with the confirmed positive, they are all on home quarantine, forcing the GFD to make adjustments and shift personnel from other stations to cover down.
We might have to modify operations, meaning a combination suppression and rescue unit on an engine company instead of having the 2 units separate. We might have to combine them with rescue and suppression personnel.
Decontamination was conducted at both stations. Riley stresses operations will not be hampered, and they are and continue to be in the fight against COVID.
Did we expect this to happen? Sure. We have 275 firefighters on duty. Our men and women are doing their best, but we're doing a dangerous service right now, and we're the best at what we do, hands down. Our guys are the best.
Reporting for Guam's News Network, I'm Sabrina Salas, Matanani.
GFD doesn't believe the cases were work-related, but rather through community contact. Mortgage assistance is available for low to moderate income homeowners who were furloughed or had their hours reduced. Funding for the program will come from the CARES Act and was approved by the U.S. Department of Housing and Urban Development.
HUD has approved some $714,000 for the mortgage relief program, which is enough to cover 3 months' worth of payments for some 200-plus homeowners. Guam Housing Corporation President Alice Tyrone says they worked with GURA and applied for the grant back in March.
We'll have applications on our website. Individuals can also call our office for more information. And if they wanted to pick up hard copies, they could do that as well. So it's basically mortgages, individuals whose mortgages were affected by COVID-19 and who fell behind on mortgage payments.
Some of the required documents that need to be submitted:
employer letter, verification of income and employment, a verification of unemployment benefits if applicable, Quest and so forth, 2 check stubs, a verification of mortgage, like a mortgage payment booklet or a letter from the bank where their mortgage is held, and a valid photo identification, Guam ID, driver's license, passport, or any state license.
She says applications will be entertained on a first-come, first-served basis. For more information, call the Guam Housing Corporation at 647-4143.
Our office is not open to the public face-to-face right now, given everything that's happening. A lot of our work is done online, and we have staggered shifts for our team. But there should always be somebody at the office between 8 and 5 to answer if there's any questions.
You can also visit the GHC website. For Guam's News Network, I'm Nestor Lecanto.
Adelup confirms the governor will likely extend her stay-at-home order that was supposed to end today. A press conference is scheduled for 11 a.m., where the governor is also expected to extend the pandemic condition of Readiness 1. Adelup Press Secretary Crystal Paco San Agustin said the governor will provide additional information to support an extension. And for the latest numbers, 74 people tested positive yesterday out of 718 samples. Guam's COVID case count is now 1,560, 13 deaths, 716 recoveries, and 831 active cases. Over at the airport, GIAA announces a third confirmed case of COVID-19 amongst office employees. Executive Manager J.Q. Kanata saying the employee works in the terminal's back office. The airport is undertaking sanitization of work and office areas and temporary closure of airport spaces to ensure the safety and protection of all at the airport. Entry into the terminal is exclusively to authorized employees, passengers, and those providing airport-approved essential services, along with mandatory face mask requirements, social distancing practices, and good hygiene. The airport is committed to maintaining a safe environment and will extend every effort to ensure the health and safety of the airport community. Meanwhile, 2 additional GDOE employees have tested positive for COVID. One case was identified at both Maritza Martyrs Memorial School and MU Lujan Elementary. Both cases were identified through contact tracing. This Saturday, community testing will be available in Talafofo, but only for the first 200 residents who registered for the event. The testing is at the Talafofo Mayor's office from 9 to 12. And registration is now closed. Likewise, community testing is planned 2 Saturdays from now on the 19th down in Umatic, with details from GovGuam to come. You might want to go ahead and just call your mayor's office. In national news, leaders had asked the 2 presidential candidates to stay away from Kenosha, Wisconsin, fearing their presence may lead to more unrest in the wake of a police-involved shooting. But President Trump visited on Tuesday and today. Joe Biden will make the trip to the city. Natalie Brandt has more details from the White House.
Democratic nominee Joe Biden arrived in Kenosha, Wisconsin to hold talks about the tensions that have racked that city and the country in the wake of another police shooting.
Meetings with community leaders, as well as business people and other folks in law enforcement, and to see start to talk about what has to be done.
The former vice president met privately with Jacob Blake's family, the 29-year-old black man who was shot in the back 7 times by a police officer.
I came to thank the law enforcement, the police, they're incredible.
President Trump visited law enforcement officers during his trip to Kenosha 2 days ago. Yesterday, the president threatened to withhold federal funding from cities that, quote, allow themselves to deteriorate into lawless zones. The memo specifically mentions Democratic-run cities of Seattle, Portland, New York, and Washington, D.C.
Yes, this federal government will do everything within our lawful power, and yes, the president is serious about this.
The move is expected to face legal challenges if the president follows through. With the election 2 months away, President Trump is asking his supporters to test the mail-in balloting system, suggesting they should vote twice. During a stop in North Carolina, the president told supporters that if they vote by mail, they should also vote in person.
Send it in early and then go and vote. And if it's not tabulated, you vote, and the vote is going to count. You can't let them take your vote away.
Some states do allow voters to ask for their mail-in ballot to be invalidated, but intentionally voting twice is fraud and felony in most states. Natalie Brandt, CBS News, the White House.
The COVID pandemic continues to devastate the airline industry. United announces it will lay off thousands of employees starting next month. In a company-wide notice, the airline said aggressive cost-cutting measures and proactive debt-raising efforts were not enough to avoid job cuts. In the memo, the company says each of our operations leaders communicated directly to their teams to share the heart-wrenching news that approximately 16,000 employees will be notified of an involuntary furlough effective as early as October 1st. The message went on to say, quote, to each and every person impacted by the news, we want you to know that you are still a part of our united family. We look forward to welcoming you back once this crisis is over. KUAM reached out to a company representative. However, we were not able to confirm how many Guam employees will be affected. And that is your news. We'll continue the show right here on The Link after this break.
CBS Primetime.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
Coming up, Gayle King's exclusive interview with Facebook's Mark Zuckerberg about the social media giant's new election security measures. Plus, meet a group of teenagers bringing fresh food and hope to their community. Coming up on CBS This Morning.
Good morning. It's The Link on the Breeze 93.9, 634. Friday, woohoo! The 4th of September. And let's go ahead and go to the KUAM News Zoom room. Again, coming up on the show, we got Crystal Palkos and Augustine kind of giving us a heads up on what the governor is inclined to announce this morning at her press conference at 11. That'll be all over the stations of KUAM. We also got Dr. Hoa from the Physicians Advisory Group. Public Health will be on. We'll do breakfast with the mayors and kind of a law enforcement thing with Sergeant Tapau and Major Uggan from DLC. And then Bear from Show You Roll will come on and kind of check in from Cali. 6:34. Let's go to the KUAM News Zoom room where Dr. Peter Lombard is standing by. And Doc, so we brought you on, I think it was last week, to talk about the danger of the screens, which is kind of like what you do as your job. And now we're back to bringing you on to talk about COVID stats. And so we'll start. Well, good morning, first of all.
Well, good morning, Chris. Good morning, Sabrina and Jason.
Good morning.
What are the numbers telling you, Doc?
Well, I think a lot of people are seeing at least the huge numbers we were seeing a week or so ago. We're not seeing those kind of numbers over the hundreds anymore. That's a good indication that we're sort of turning the corner here for this most recent surge, at least. So that's the good news. I mean, the numbers are still pretty high. Yesterday, I'm just trying to look at them this morning, actually. As you guys know, the DLS was not able to report any tests, so we had a big number of those. So if you even if you sort of distribute those out over the past few days, I think it's still pretty clear that we're coming down a little bit. I think our 7-day average is still around 60 to 70 cases per day, though, which is still a ton. If you figure maybe about 10% of those will be admitted, then we're looking at admitting 5 to 7 a day. And we have to be discharging the same amount in order to keep our hospital numbers the same, and that may indeed be possible. So this is a good milestone. It's still a lot, and we're still going to see some people die probably. So it's certainly not out of the woods, but the PCOR measures are certainly having an effect now.
Doc, what do you make of the testing positivity rate, though? Because I mean, like you said, we're not getting 117 or whatever we had last week, but we're getting that 10%, 11% testing positivity rate.
Yeah, that's a good point. I mean, if they were doing an extra 200 cases a day, that would mean an extra, 20 cases potentially, but probably even less, because if they expanded the testing a little bit more, did more community testing, then you'd probably figure also a lot more of those are going to be asymptomatic or mild symptoms, or I think in that group of tests you would see a decreased positivity rate. So overall, I think you would add some additional tests, but even so, I think it would still show that our overall numbers are going down. And with the stay-home order, there's no way it can't work if enough people are doing it, and I think we're starting to see that finally. But it's really going to take, it would take a few more weeks of this before things went down to the levels that we were seeing before.
What are you hearing with what's happening over at the Guam Memorial Hospital? I was just looking at this latest report with 9 people in ICU. I think it's 45 hospitalized. We've got a team that should be here from the military. We have 32 doctors and nurses and other employees at GMH that have contracted COVID, and we have a suspected nosocomial infection under investigation at GMH. How would you describe the state of our hospital?
I think if you look at other hospitals, it's instructive too, and you'll see reports and studies where they've looked at this, and they see anywhere from 5% up to 20% of hospital workers can be infected by COVID. And it won't always be entirely clear if they get it from in the hospital or from home, but still, it's at least a useful number to try to compare to what we're seeing here. So I think it's not surprising. It's something that you have to be almost anticipating and doing everything you possibly can to try to keep the numbers as low as possible. Presumably they've got their procedures in place, and as soon as they started to see a few cases, they try to tighten things up. But to some degree, perhaps they're doing all they can. Perhaps there's more things that they could do. I assume that they're doing an investigation with every person that's positive to try to figure out where were the links in the chain that allowed their hospital workers to become infected. There's just a lot of people with COVID in the hospital right now, and just from a patient perspective, and a lot of them are very, very sick. And the ones that are more severely sick and intubated, these are the ones that are probably shedding the most virus. So those are the frontliners that are definitely at more risk. But it's amazing to I've seen some of them as patients, and to hear their stories, and very brave what they're doing, going in every day knowing that they're putting themselves at risk. Some of them even older in the older age cohorts. Mm-hmm. So that's the concerning part. I mean, our numbers are high enough that even though most of our cases are still in the lower age groups, we're getting more people in the upper age groups now. I was able to do a bit of an age analysis, and it looked like before the first week of August, the percentage of patients, positive cases that we had in the age group of 60 and older was less than 5% or so. And last week, it looked like it was over 10%, maybe even 12%. And if you just go by numbers, last week alone we had 60 people, almost 60 people over age 60, and that it was 3 in their 90s, and 5 in their 80s, and 13 in their 70s. And there's very good detailed reports out now about what the fatality rate is per age group, because you can't just it's tough to just throw a single number out there and say, here's what your chances of dying are if you get COVID, because somebody that's 20 that gets it versus somebody that's 80 is wildly different. We know 1 out of 10 people in their 90s and 1 out of 25 people in their 70s, statistically will pass away. So just doing a real, my own, again, non-official calculations for the past few weeks based on the numbers of people we've had over 60 and applying a very age-specific fatality rate to them. It would have predicted about 4 deaths by this weekend, and we've already had 8 now, and it predicted another 11 by the end of next week. So I think that I think we definitely have more fatalities coming, and even if our numbers stay in the 50 range, which is good hopefully from a hospital maintenance standpoint, we're still certainly going to see more deaths, and it shouldn't be surprising. And I'm sure they're doing all they can over there, and it's just it's probably coming, and that's a sad reality.
Gee, thanks.
Yeah, thanks for that, Doc. Sorry, I want to go back to the nosocomial infections. I mean, at this point, there's sometimes you can only laugh. I don't know why we're laughing after hearing that, but going back to the nosocomial infections, Doc, at what point when we have these 32 cases, is there a point where we got to look at like, hey, what are our measures? Because when we talk to Lillian, we hear things like, oh, they have a COVID section in the ICU that's pretty much a plastic curtain, and we read in the Army Corps Engineers assessment of GMH that there are problems with the ventilation system. So, and just seeing like that number, 32 infected hospital staff.
Right. And that's, it was 12, right, during the first wave.
Right.
So you would think, okay, there's something going on, but, it may or may not be related to, conditions.
Yeah, it's kind of one of those situations where if we're not sitting at the table, if we're not one of the people helping to plan the investigation into why this happened, I think it's hard for us to be able to know for sure. Is there something intrinsically wrong with GMH that it would be beneficial for us to think of some other option for them? It'd be nice to get somebody else from GMH, if one of the ICU docs or something to come and speak to that. It would be, I think, useful.
Right.
What do you think, though, about the whole debate of we should move the non-COVID patients out of GMH?
Yeah, I feel like it's the same thing. Like you're not sitting at the table. You weren't there when they went through their analysis and had the pros and cons for moving. And I'm sure the list is pretty long of reasons why a move wouldn't make sense. And it'd be great to see that list just from our perspective, because we would have a better understanding of their reluctance to do something like that. I just think there's a lot of reasons why that I just don't know.
Right.
But again, we're just kind of trusting the people at the table are making the best decision, and we hope that's the case. But all along, I've heard them still say, all these options are still possible, and that they're willing to consider them. So that's good. I think they are showing an open mind. Dr. Nguyen has always said that as well. So. At some point, if the evidence becomes overwhelming that GMH is not a safe place, or that maybe we'd have a little bit more success controlling things like nosocomial infections at another facility, and perhaps that they would reconsider. But probably have a lot of difficulties and challenges to overcome to make that happen, and we just don't know what those things are.
We're just letting that sink in for a minute, Doc. Wow, so you're laying it down pretty heavy here.
With which part?
Well, just the fatalities
rate.
And yeah.
Oh yeah. Well, hey, it's if it's hard, again, it's hard to look at the numbers of people that are over 60, but they give the age report. It's a cumulative, so you kind of have to really keep track each week or each day almost, and see which numbers are changing in which age group. But it's 30 people over 60. Or 60 people over 60. That's a lot.
Yeah.
And if you look at the last 3 weeks, and it is what it is. And then you add more comorbidities in there, and we may end up doing better than that, and that's certainly hopeful. But that's just it is what the numbers are right, predicting.
Yeah. And I think that's what's alarming for us, is because we've folded you into this COVID conversation for months now, and I think you're reasonable, right? You don't have alarmist tendencies, and so to hear you kind of coming from your detached, I'm looking at these numbers and this is what I see, and we're definitely going to get more fatalities. Brace yourselves.
Mm-hmm. We know that the reason why we haven't seen them yet, I think and I hope is the average time from symptom onset to death is 23 days, and this is from looking at thousands and thousands of cases all over the world. So 23 days. So you really have to look back 3 weeks from now to see the numbers where our numbers were really, really high, and those are the deaths we're seeing now. So even even if we see a pretty big handful of deaths over the next week, we're not done yet. We're still, where the curve is still hopefully starting to come down and coming down. But, as long as we still are picking up cases in their 60s, 70s, 80s, and 90s, unfortunately, we're still going to have more people succumb to the COVID disease.
What are your thoughts on the community mass testing? So, people have been clamoring for this. Public health said, man, we don't have the resources to go out and test 1,000 people. We saw this tremendous, almost a 2-week backlog where people got tested and they didn't get the results till, like I said, 9, 10, 11, 12 days later. And so now we're hearing,
you've got to have.
Now we're hearing they're going to do a mass testing in Talofofo. That's this weekend?
This Saturday. Tomorrow.
Yeah.
Tomorrow.
But it's limited to the first 200
Yeah,
people.
you had to have registered.
Oh, wow.
For it.
Yeah, and it's already full. And so I'm just seeing in my mind, people hear mass testing, they're going to show up, they're going to think they can get tested, and then the whole, why are we only testing 200 people is going to start.
Yeah,
that's nuts, right, Doc? That's kind of nuts for people at Talofofo. What? They're doing a mass testing? What? It's already full?
Yeah. And I mean, that was the press release. There wasn't. I don't even remember seeing a press release saying that, hey, if you wanted to go to community testing, then call your Talofofo mayor.
It was actually Mayor Doris Lohan on our show who just mentioned it anecdotally, and all of us were like, whoa.
Right,
No one knew.
Wow.
So sorry.
Yeah, no, I
hadn't
heard that.
By the way, Doris
they've got to
isn't the
have
mayor of
the
Talofofo.
facilities available on the testing.
So what are your thoughts on that, Doc? Do we need to do more community testing, less?
Well, the idea is to identify every single positive we can, because once then you can not only isolate, but then you can also start to look at your close contacts and get them tested. But if you just can't test them fast enough, then I think that it's this probably more harmful if you can't run the samples fast enough. But in general, the principle of testing more people is always going to be better. I think we see that in many different places all over the world. So I'm an advocate of that if we have the capability to do so. And I do think that we're going to see a bit of a change in terms of once these new tests come out, these more rapid tests that are more inexpensive. I think over the hopefully next month, we're going to start to see some of these rapid tests become more available that are FDA or EUA approved, and that's going to really kind of change the whole testing game.
Well, Doc, we're waiting for the official announcement to be made by Adelup about the likelihood or that this PCOR 1 will be extended. You agree that that needs to be done considering the numbers we've been seeing this past week?
Well, I'll say this: when we first went into PCOR 1, I think I was a little bit I thought it was a little bit too strict, and what I wasn't expecting was how rapid our numbers increased. It wasn't just this kind of slow rise. It was just immediately just boom. And we were seeing numbers in the hundreds, which was pretty sobering. And then in retrospect, you feel like, wow, that was a pretty good decision. We'll never know if some other plan could have worked, and we'll never know what differences we would have seen if we did sort of a modified PCOR 1 that was a little bit tighter or a little bit looser, or PCOR 2 that was a little bit stricter. But I think we're lucky that it is what it is, because I don't think our numbers would have come down quite as fast if we had any other measure. But what's enough? I think not only are we had this order in place, but also people started to see more people getting sick in the hospital and dying. And now it's hard to find somebody in Guam who doesn't know somebody who either has had COVID or everybody knows who the governor is. And so, but then not only that, but there's usually some personal. There's a personal, I think it's affecting people more personally now because they know of somebody that's been sick or maybe who has even passed away. So as that happens, the fear increases and then people start changing their behaviors, regardless of what the mandates are telling us to do at any given time. And I've always been more I try to be more balanced. I do think it's possible to open up more business, because I just don't think that the businesses are the drivers of the community spread. It's just to some degree, and maybe certain businesses, yes, but most businesses, I would love to see them open as long as adequate protections are in place. I'd like to see that happen.
All right. Thank you so much, Doc.
Yeah, thanks. Thanks for the downer.
Sorry, happy Friday.
Yeah, there you go. Good save.
Well, stay safe.
Hey, you're all going to die, but it's Friday, guys. Okay, Doc. Appreciate it. Yeah, be safe, okay? Wash your hands.
Okay.
Thanks,
guys. Bye-bye.
Okay, bye.
Dr. Peter Lombard. Sorry, guys. We're a little dark.
Happy Friday. Oh,
Oh, boy. I think we need to take a break, okay? We're coming back with Crystal Paco St. Augustine, the Adelute press secretary, who's going to give us a little bit of a heads up about what could be announced at the governor's press conference at 11 o'clock this morning. Again, it's containing COVID on a Friday.
Happy Life Insurance.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
It's Friday, September 4th, 6:56. Good morning. Bree,
Yes.
that is the right mask to wear.
The Santa Maria Carmelin mask.
Viva Santa Maria Carmelin! Yeah, look at that. You guys, can we check that, dude? Yeah. Bree is rocking the Santa Maria Carmelin mask.
You know, I saw it. I actually saw it on Instagram like weeks ago.
I gotta get one of those.
You know what? I got you one. Don't worry. I got you.
Nice.
They have it at Payless, and so they sell it originally in a Gagny shopping center.
Mhm.
And so I tried to go, weeks ago when my son was taking him to class jiu-jitsu, but the timing was like Gagny shopping center closes at a certain time, so I never was able to go by there. And so when I saw it at Payless, I was like, oh shoot, let me grab. I grabbed like a few.
That's cool.
Yeah.
We didn't mean to do this, but we're wearing like the colorful masks today.
Yeah.
Hey, good morning, 6:58. Okay, let's just go to the KUAM News Zoom room where standing by we have the Adelup Press Secretary, Crystal Paco St. Augustine. Morning, Crystal. Pretty sobering conversation with Dr. Peter Lombard. I know you caught that. And with that being said, we're anticipating, thanks to you, an announcement this morning with the governor at a press conference. And now I know you'd put something out yesterday that said the governor's inclined to extend the PCOR 1 lockdown. And so we had to bring you on to find out what else you can tell us, just between us.
Just between us and the people of
That-
Guam, right?
yeah. No biggie.
Good morning, Bree.
Good morning.
Chris, Jason, and Joser, and the people of Guam. Happy Friday. Today, people are expecting some big news out of Adelup, of course. Today at noon, we do expect that existing executive order relative to that stay-at-home order to expire at noon. And so what's going to happen, as I did kind of preview you or tip you off yesterday, was that the governor is inclined to extend that. And that's what's expected to happen today. Governor Leon Guerrero is expected to sign an executive order today at our 11 o'clock press conference, 11 a.m., extending the pandemic condition of readiness 1 status. That's the PCOR 1 status, as well as that stay-at-home order that is set to expire at noon. What this new EO would do is extend to September 11 at noon, so 1 week from now. So we're moving week from week. As you know, what we know about coronavirus is it kind of takes 2 weeks for us to see any of the results from the policies that we institute. So we've been about 2 weeks. Today, I think marks 2
It'll be
weeks
2
of this stricter version of the PCOR 1 status. And so hopefully by next week, we can start to see those numbers make a downward trend. And then, as you heard Dr. Felix Cabrera many times on your show, speaking that there's a week lag at the hospital setting. So you can start to see that downward trend 2 weeks after the policies are instituted. And then about a week later, you'll see the hospitals decline. And that's kind of our hope. And that's the kind of presentation you're going to get this afternoon or this morning, 11 a.m. again at our Zoom press conference. Who you can expect in the panel is our governor, of course, Lieutenant Governor Norio. You can expect Art St. Augustine, our public health director. You can also expect our Guam Memorial Hospital Administrator, Lilian Perez-Posadas. You can also expect Dr. Felix Cabrera to present on his data. Again, as much as we love his data, we always hope for his data to be wrong. We always want to prove him wrong, and those trends.
Yeah, it's
we wanna
easy.
prove-
Just tell them to flip the charts upside down.
No, but we definitely use his data as a guide, as a measure, as we proceed with our response and how we need to pivot. Because, as you know, it's not a cookie cutter response anywhere. I was seeing a graphic about what Oahu is doing for their stay-at-home status, and it's like no singing, no lying down,
No
It's like,
saxophone.
wow, no saxophone. So I would
Right.
be very unhappy
Right.
in Oahu right now with no music, right? So that's what you can expect to happen. Again, those are some of the members of the panel. You can also expect Dr. Jolene, again, from the Guam Memorial Hospital, to be on our panel. And you can ask them all your questions. The people of Guam just want to know what's happening. They want to know how to plan what's next. And in times of uncertainty, even if you can learn how you can plan for the next week, that's some comfort. And so people of Guam, you can expect a stay-at-home order for another week.
That's a pretty large panel. Does that mean that we'll get extra questions for each panelist?
I haven't asked that yet, but I still think usually it's one question and one follow-up, and that's just for time. Everyone has a lot of meetings to go to. Again, that's very that's our key players in our response
Right,
efforts, and they
right.
have a lot of meetings to go to, a lot of Zoom meetings, of course. I can report out of GMH some good news yesterday. Yesterday afternoon, our DoD medical assignment team started. And so we hope to put something out in the JIC this morning or this afternoon, or maybe even you can get the latest at the press conference. So we have 8 total healthcare professionals that started yesterday. I do have a picture. Lillian sent it to me. And so that's some help for the hospital, because we all know that the hospital needs it. You're probably going to want a census now, Sabrina. As of 5 a.m. this morning, Guam Memorial Hospital's census was 49. So it's pretty crazy. 49, 12 of those are in the ICU, and 10 are on the ventilator. And so the numbers don't lie. If people were wondering what the governor was going to do, I think the numbers kind of speak for themselves. Every night we're seeing at least a 10% positivity rate, especially between just the labs themselves. 10% positivity rate from public health, from Naval Hospital, and also from DLS last night. And so 74 new cases, that's 74 new contact tracing investigations, that's 74 people that'll need to isolate, and then potentially many of those would end up in the hospital or need some type of medical care. And so very disturbing, and we want to try to go towards this downward trend and flatten that curve.
How many just wondering how many more beds are left at GMH to be able to take in COVID patients? It just seems like we're starting to run out of space.
I can have Lillian speak to that this morning at the press conference, because I know that they have shuffled our hospital staff. They're very they're resilient. They'll move around what they need to. I know that they put up some walls so that they can make more beds. And then the SNU, the skilled nursing unit, is expected to open this weekend. Governor's orders are that we open as soon as possible. A little frustrating to have such a delay in that project, because early in March, upon our first few cases, one of the first things we did was visit the skilled nursing unit and the A wing, especially. You want to open it in phases based on staffing, based on what we can do. We've got to think that, we're spreading our legs out. We're going to get this new facility, but do we have the staff to manage it? And so I personally took a tour of the skilled nursing unit early on in our response, and this chiller has been the bane of our existence. And so hopefully this weekend, fingers crossed, actually not even fingers crossed, we will do it. We will move into the SNU this weekend, open that A wing. The chiller again is very comfortable. It's just a matter of staffing. Yesterday afternoon, Lillian did report to me that the medical assignment team, consisting of 8 healthcare professionals, who did start.
The A wing, how many beds is that? Do you know?
I don't have it at the top of my head. I'm so sorry.
Okay. Oh, it's okay. It's okay. I just.
It's not early.
Do you know if it's the military team that's going to be deployed over to SNF, or is it going to be a GMH staff?
Probably going to be a mix of both. I'm pretty sure we'll, because six of those 8 are critical care nurses. So we're probably going to spread them out to where the need is. Again, my briefing with the hospital, or Lillian gives me an update at 10 a.m. at our 10 a.m. ops meeting. So a little too early to know that information.
Okay.
But good news, everyone can appreciate that the Guam Memorial Hospital is getting some help.
Right.
Well, Crystal, when you put out your statement yesterday, you said that the let me just pop that up. You can confirm that the governor is inclined to extend both her stay-at-home order and Guam's PCOR 1 status based on information she'll provide today. Can you tell us anything about that information? I mean, it kind of seems, in just getting the numbers from you, that we've seen the number of patients on ventilators. I mean,
it's 10 people on ventilators.
Right. So it was, I think, 3 the last time we spoke to Lillian.
I can't remember. I know this is pretty significant. This was not double digits last time we spoke to Lillian.
And so is that kind of what you're anticipating the governor is going to say, is that, hey, with the hospitalizations, maybe more specifics that are going to justify her decision to extend this lockdown? I mean, along with the test numbers, of course.
Most definitely. And, we're nightly. Every night except for Sunday, because we don't get data or information on Sundays, is that the Joint Information Center puts out these nightly numbers for the results. And again, you're seeing that 10% positivity rate every single day. You're seeing 3 deaths in a day, and that was very, very sobering. That was devastating. And the governor again calls each of these families to give her condolences. You're seeing 1,560 cases to date. For our small island, that means each and every one of us knows somebody that's been infected with coronavirus. And so this hits close to home. As you know, it hits close to the governor and lieutenant governor's home. I mean, them catching it. I don't believe Lieutenant Governor has been released from isolation yet. I hope to report that soon. The governor herself contracting the virus. And so the numbers don't lie. Dr. Cabrera is our data man, so he will present. Again, you know that the recovery plan, the Chalampara Hanemla plan, it's based on those 4 triggers, 2 of which are hospitalization rate and case positivity rate. And so knowing what we know about our healthcare system, this is it. We're not in stable condition.
What condition are we? Stable? Critical?
I would say we are in critical condition, but I don't have an MD, so just personally from my observation, from being a frontliner in a different sense. Again, kudos to all our nurses and our doctors. I heard Dr. Hattori Uchima's interview with you yesterday, and it's so great. Thank you so much for giving our nurses and our doctors a platform every Thursday, just to hear them out. And I think that's a story we need to tell now. And I think as a communications person, that's where we need to shift our messaging is, hey, stay home, not just for you, but also for the people who are working hard so you can stay home and so that we can all be safe. Because in the beginning, we had a great response and we had a controlled number of cases. We were seeing, 0, 1, 2, 3, and our hospital staff are still working around the clock. But now we're seeing 74 overnight, and now they're still working around the clock. And now you're seeing triple, quadruple the rate that we had in hospitalization. So again, 49 people in the hospital right now at this very moment, and that's just Guam Memorial Hospital. That's not including Naval Hospital. I don't have the update on their census, their COVID census, and that's not including Guam Regional Medical City, who I believe also have a few COVID patients. And so, you don't have to be a mathematician, you don't have to be a doctor at this point to know that we need to do better for the people of Guam.
Yeah, and while we're on the subject of doing better, Chris, what would you say to people who have been clamoring for the mass testing, and then we find that they're having one in Talafolo tomorrow, but it's already filled up? And I don't know if we got the memo about announcing the sign-up process. So, I guess, and we'll get public health on later, but how would you respond to people who are, like you said, seeing these hospitalizations, seeing they got 10 people on the ventilators, we had, positives, 10% testing positivity rate, and people out here want to get tested, right? So when they hear about a mass testing that they can't show up to, it's probably not the best news for a Friday morning. So what would you say to those people?
It isn't the best news, I admit, and I agree with you. But here's the thing. We have to recognize what our capacity is. We'd rather have people know their status right away after taking a test than waiting 10 days. And so at the request of the call out to the community, that the community wanted mass testing, we did it. And then we realized, oh no, we can't handle this. We can't manage this. We have to manage expectations straight up. As a communications person, again, we want to make sure that we give people an idea of what they can expect. That's why I'm on this interview right now, to tell you what you can expect at the press conference. We got to manage expectations. Talafofo and Pneumatic were both testing sites that had been pushed back, I want to say, for over a month now. They were initially delayed because of inclement weather. I think remember that week, and then it ended up being like the sunniest day ever. And so those were 2 sites that had been pushed back. And so when we worked with the mayors, it was decided that, let's pre-register people. We've been waiting down here in the South. We never want to neglect our Southern residents, because they were actually, in the beginning, they had very few cases. And now we're seeing that coronavirus is affecting every single village. And so all of Guam is turning blue on our nightly situation reports, right? So you would have those few pockets where there was no coronavirus, and now the whole island is affected. And that's 1,500 cases today. And so for the people at home that are frustrated to know that we have a community testing and they're not able to go, I sincerely apologize, but we want to manage expectations. Perhaps, and maybe a medical person can speak to this, perhaps the reason why the high positivity rate is because we're doing targeted testing, because we're going straight to the source. We're going straight to the people who had close contacts with the confirmed case. We're going straight to people who are feeling the symptoms. And again, the stay-at-home status, that's my dad coughing in the background. The stay-at-home status, enables us to kind of play catch-up, to kind of stabilize our response. I can tell you some great news will be coming out of University of Guam later this weekend as we finish the contact tracing training. I think LT, Lieutenant Governor, spoke about that earlier this week. So we're building our capacity, and as we build our capacity, more people can expect more testing for all. And so in the beginning, you saw in our response was that it was only testing to people who were surveillance cases or PUIs, person under investigation, right? And so in the beginning, we had 20 tests. We've really expanded. We can do a few hundred a day. We have our partners with Guam Regional Medical City. We have DLS online. And in addition to public health's ability to test like 300 a day, we also have our private clinics. I know Dr. Wen is on the line too. And so we continue to build capacity, but we also have to be realistic about how pumping out those results. And so now we also saw that as even though we were able to test everybody, then there was a delay in calling back people, because those same nurses that swab you at the community testing, they have to be the one that calls you, because you have to get your results from a nurse. And so as we build capacity, we'll increase and expand testing. So to people of Guam, if you are experiencing symptoms, please call our medical triage, call our 311 hotline, click number 1, speak to a nurse. Or if you're really, really sure you want to get tested, you can call your private clinic and you can work on that too. So again, this Saturday, we do have a testing. It is basically all pre-registered people are ready. Registration has run out. And so 200 people will be tested. We'll see 200 new results. Again, the South has been wanting these testings. These have been delayed for several weeks.
I want to just go back to the hospital. Do we anticipate the governor to make any announcements, or the Guam Memorial Hospital make any announcements about moving out a lot of these non-COVID patients out of the Guam Memorial Hospital?
Oh, I'm not sure yet. Again, my briefing is after this interview, so
okay.
If you give me
okay,
you'll
so
find
you
out.
don't know anything. Okay, but that's never been something that has been discussed. Considering
Governor's
that
always wanted to, KMH has always been our COVID designated hospital, and we realized we need some room, and that's what the SNU is for. And again, we will be moving into the SNU this weekend.
Okay. Do you know how? Okay, you won't know. All right. In terms of the executive order that she's signing at 12 noon, and the PCOR 1 extension, is there anything different from the current PCOR 1 and the stay home order? Should we anticipate anything added into this, or is it going to be just the guidelines we're following now?
I'm tracking that it'll be status quo. I know the last week, we did change things up a bit, and we did open parks and beaches for individual use only. And so that was the biggest change last week. There will be no major changes in the stay-at-home order that's going to extend until next week, Friday. So no major changes. If you're open now, you're able to stay open. If you're closed now, then you have to stay closed.
Okay. I don't have anything else.
Okay. Thanks, Crystal.
Thanks, Chris. See you guys at
11.
See you
Right?
11.
Yeah. Let us know about those extra questions, because I hate having to try and fit 20 questions into. It's
Only
funny
because you do, you guys have some big ballers in this.
Yeah. And I mean, I
people we need to
understand,
talk to.
that
GMH.
people have Zoom meetings, but the accessibility to these. I mean, we get them on the show, of course, but when you put together a big panel like that, I just think it behooves you guys to allow the media the opportunity to ask as many questions as we can. So, well,
or at least a couple more questions. Yeah.
Right.
Hour plus press conference is a little daunting for all of us, especially for the governor who's standing there the entire hour. So thank you for this opportunity, and I'll see you at 11.
Okay.
Thanks, Chris.
Goodbye. 7:16. Let's go to the KUAM News Zoomer. Let's get the governor a chair, though, so we can have a longer press conference.
Just you could just ask. You could ask the governor all
Bree.
her questions,
Yeah.
and then for the rest of the panel, then she can leave.
Yeah. I mean, really, to me, it's just ridiculous. This whole one question, one follow up, especially at a time when, I mean, the average person probably has like 50 questions. 7:16. Well, let's go. I know we got some questions for Dr. Ho Wen, the chair of the Physicians Advisory Group, as they had another big meeting last night. Doc, good morning.
Good morning, guys.
Good morning.
Okay. Good morning, Sabrina, Chris, Jason.
Okay, I don't like this. I don't like this. I don't like this. I don't like how this is starting.
Oh, no.
I feel like you're about to tell me I got 2 hours to live.
Happy
It's
Friday.
okay. It's nice to have Crystal say about the testing this weekend for down south. That's the right thing to do, and I think I appreciate Public Health in adjusting their way to do things. So pre-register is very nice. So you know that if you wait and you register already, you will have the test and you control the capacity of the test. So they do 200 tests for that day. Yeah, they should be able to run it and turn around 48 hours and get results back to the people. And then from then, if you have positive, the contact tracing will be done within a day or two. So that's the really correct way to do things. So they are adjusting themselves. So I think that's a great move on their part to do that. So so the kudos for them for see the mistake and fix it. So that's very good. Nice to hear from that Crystal say that. So, but again, the goal is just test people, mass testing 200 people. If it's positive, the tracing team will have 1 or 2 days. I think the goal is within a day or so, they have to contact the positive person and then do the tracing from then. So it's very good. We talked about last night, and I tell you, as we move forward and this thing, and we're gonna try to change the quarantine in the hotel, and I think the Public Health will announce that. I think that everyone pushing for the quarantine in the hotel for 7 days. It doesn't matter what you do, you will be quarantined for 7 days in the hotel, and then testing out at day 7. If you're negative, then you will be sent home with apps. I think the Sarah Alert, that's the one that the most likely going to use. And you have to download the app. If you don't, you stay in the Q factor until a full 14 days. And that will help people to kind of report their symptom and anything they have 2-3 times a day. So it help Public Health with tracking you at home to make sure the compliance rate is there. Okay, so that's our one of the failures we have the home quarantine before is basically we didn't track the people at home and so a lot of people didn't comply with the home quarantine, and that's how most likely one of the costs that we have a surge at this point. So I think this way can be a lot better. At first, the first 7 days, we're going to catch you if you have the virus in the Q factor rather than you are in the community. So that's something so we can send people home earlier. They probably take Public Health about 2 weeks or so to come up with things. So more likely the next 2 weeks or so, we will see the change.
Oh, okay. So you're looking at that change in protocol 2 weeks from now. Right?
Yeah, they have to put every step together. So I know we've talked to the director, the governor. I think everyone pushing the same way. They just have to put a structure together in order to make it happen. So,
Doc,
so we try to get our people home a lot sooner.
Whatever happened to the Emoca app? You still using that? Public Health?
I'm not quite sure, but
you remember that, right?
I know the Sarah Alert. Yeah, but I think the Emoca it's the capacity. I think they have a limitation to how many people can use that. But the Sarah Alert, like 100,000. So for our island, 100,000 is a lot. So so it's doable. We don't have capacity we have to worry about.
So
and if you're going to drop off in the week anyway, so it's a revolving thing. So you won't exhaust 100,000 capacity.
Okay, so just so everybody's clear, we're still under a 14-day mandatory quarantine at a government facility, regardless if you have a negative test when you come into Guam. The plan is that after 7 days, 1 week, you will be able to test out. But if you test negative, you have to download this Sarah alert so that you can be tracked digitally and monitored. Correct?
Yes.
Okay.
It's not tracking where you are.
Or,
It's
I
make
mean,
sure that
monitor.
You comply with
Right.
reporting the signs symptoms. Yes,
But if you do not agree to this, then you have to stay and fulfill that 14 days, right?
Yes.
Okay.
You don't have a choice.
Yeah.
We have to protect our border somewhere. Yeah.
Doc, what was the conversation like in the meeting last night about the increase in hospitalizations and the other stats that we heard this morning about the jump in the number of people on the ventilators?
Yeah, 49, 12 in ICU, 10
Yeah.
on ventilators.
Yeah, 10 on the van. Yeah, that's what we was telling you in about 2 weeks ago, right? I mean, the hospitalization usually lag about 2 weeks or so behind. So this is where you're going to see this week, and hopefully it slow down by next week. We keep our finger crossed. If things supposed to be like they are, I know the positive rate still going up. You see a lot of positive, but if you look at it, it's in the Q factor. It's a tracing from public health. It's like 26 or something, 27, 28 yesterday from tracing. So every day there's a double-digit number that the public health are tracing, and so that's really good, because that's what we want. I mean, they do their job and they go out there with positive and track back all the people that come in contact with the positive. So those positive are nice to have. I think that we are slowing down as a clinic-wise. I talked to the major clinic, and we are seeing the slowing down the sick visit. So either that means that it's good that we have the I think the sick people that is coming down, either that or the sick people are staying home. I don't know which one, but we do see a decrease in the sick visit in the major clinic. So, if the trend continues like this, I think we should see some slowdown in the positive rate by next week. The hospital still stay behind. Right now they have really sick people in the hospital. We talked to Dr. Agon yesterday. I mean, we have some really sick people, so we all keep our fingers crossed and pray for all those people in the hospital to make sure that we don't lose anyone else. But yes, we are reaching way over our capacity at this point in the hospital.
Reaching it, or we are?
Oh, we are. We already passed already. Yeah, we passed that mark, and right now, I would say that with the help of FEMA, I know there's some physician and some nursing staff already on the ground and working. So we give GMA some relief and the manpower and nursing staff. I know some of the RN that is possibly for, they should be released from the isolation and they should be back to work. So they have some backup there, but they are really swimming at this point. So hopefully they doing okay.
But Doc, this is only for 30 days. They're only going to be here for 1 month, and Gov Guam has to, from what I understand, demonstrate, right, that they're recruiting and then they're hiring, and have a contract in place for medical support. So I mean, are we going to be able to do that?
Exactly. Yeah. But FEMA, the help will be here no more than 30 days, and they have a person on the ground that try to work with GMH and to try to do some recruitment. I mean that we have to try to recruit nursing staff from off-island, physicians from off-island to come in to augment their staff at this point. There's no way you can recruit on-island. The shortage both at GRMC and GMH and on the clinic, so it's very hard to recruit on-island because we reach our capacity on our healthcare provider on island already, so I have to go off island. But that's what they have to do, demonstrate that hey, we are trying to bring some people in. So
do you know, Doc, though, what happens?
As long as we try.
Okay, so what if we can't get people to come when this 30-day expires? Are they going to stay here, or what happens?
Yeah, I mean, as long as they see us trying, it's very hard to I don't know, if you pay people enough from the state to come here, the local tenants, you will get people to come. I think the case of state is slowing down, so I think they should be able to recruit people to come to Guam to help. I think as long as your action is there, they see that you try. If you cannot and no one want to come, then I think they will stay longer. They won't leave in 30 days. But as long as you have to show that you try.
Okay. Was there anything, any other issues that you guys discussed last night? The nosocomial infections, any more doctors, nurses, hospital staff that have contracted COVID at GMH? Other than the 32?
I don't think there's any new one coming. Yeah, I don't think there's new case, Sabrina. I mean, basically they, I think they kind of got a hold of what's going on. They took some action to fix it. Like I say, I still highly encourage the doc to come out along with Lillian. And I say again, the physician need to come out with Lillian. Especially Dr. Jolene Agon and Dr. Ann Bodario, they need to be on the press with Lillian because they can better answer the step that they put in order to prevent things from recur again. I know that they identify what the cause of it, and they took steps to fix it. But again, they owe to the people of Guam to let people know what happened and what they did to make sure that there's no recurrence case of nosocomial infection in the hospital.
So what happened?
Sabrina?
Yeah, so what happened?
I think it's a case that, like I say, when you work for so long, 12, 15, 16 hours a day, sometimes you put your guard down, including, especially, if you having a staff dinner, you eat together, some of those stuff, is basically no one pay attention to those things. It's kind of important to that, when we work together, and remember the lunchroom, even in my clinic, is very small. When you have a whole bunch of staff get together to eat lunch, you always take a risk of spreading the virus. You have it, especially if you're asymptomatic. So little thing like that can cause a lot of problem, and no one can anticipate ahead of time, in order to prevent those things from happening. Even our clinic, we have to look at the whole ways when people eat lunch together, where they're gonna sit, all that kind of stuff. We have to make sure that we change things that we do every day. So, like I say, that's part of the step that they take step to correct at the GMH. So I think that the person that really need to say something or explain to people is really the doc. So I want to press them again to really get on either KUMU guy, okay, either Dr. Agon or Dr. Bodario, and they really had to be on your show. So I'm going to push a button again.
Yeah,
okay?
Can you push all the buttons at the same time?
Okay.
Yeah.
I sure will, guys. But they need to come out. I keep pushing.
We've been asking. I always ask when we get Dr. Agon. I didn't even know Dr. Bodario was the medical director because we never hear from her. So.
Yeah, Dr. Agon, guys, I tell you, if anyone worked the hardest on this pandemic, I gotta give that lady a thumbs up. And you can't say thank you enough for her sacrifice for this whole island. She's she's a very special person. So,
Right. And
I
Doc,
try to get her on. Okay.
Yeah,
I
please.
have always with Dr. Uggan. I don't think I've ever met her, but I have always heard good things about her. So it would be nice to finally have her on the show because
Okay.
yeah, really.
Okay. You'll be impressed. Okay.
Anything else though?
On.
Anything else from the meeting?
Huh?
Anything else from the meeting?
We most of the meeting there's a group here from UCSF that come
Right.
in and do the training for the contact tracing. It's very impressive. This is where we're gonna fight this virus by, have a lot of people trained correctly to do the contact tracing, and there's something the person say there, it kind of trigger and say that you don't have to be a trained person, and you don't have to be medical personnel. In San Francisco, they just pull people from different agency in the government that on furlough or whatever. They pull them in, they give them some training, and they are very effective and stand up those people. So we're gonna push as a PAC for the government employee that are currently stay home because it's non-essential or whatever. They can be trained to help stand up the tracing team. That's the most important thing, is that you need to, once you are positive, you got to go aggressively and have people call and do the contact tracing. So I don't see why the government employee that stay at home right now, but non-essential, cannot be pulled in and trained appropriately, because they give you a manual how to train them already. It takes 20 hours to train a person.
I think that was something that Annette was
help the
mentioning.
tracing team.
Yeah.
Was they had been contacted by government agencies interested in learning how to contact trace, and I think even the Port Authority, they have their own contact tracing team. At least we get the press releases from Bernadette, and it says that they have their own contact tracing team. So
Sabrina, they have to be trained appropriately.
I see.
It's not just you just hold the person on the phone and start talking. and this UCSF team come in. They've been here for several days. I think I heard about 85 people is on the class for this training. One of them is my chief nurse, and you learn a lot out of this thing. I learned a lot out of it from talking to her. So there are a lot of things that we can do to improve our island in order to contact these people really, really fast. So that's the only way you can track them and then isolate them and prevent them from spreading. So it's important to do that. So I don't know. We should have at least 100 people on our island to do that. It's like I say, it's something that you cannot contact the positive person 3, 4, 5 days later. It's too late already.
Yeah. How about like 10 days later?
They say the goal is 1 to 2 days.
Right. Yeah, Doc. Okay, Doc, we got to run because we actually have Annette. Her ears are burning right now.
Okay.
thanks, Doc.
Yeah.
Stay
We'll see you.
safe.
Okay.
Happy Friday.
You're welcome. Be safe, guys.
Stop laughing, Doc. You make me nervous when you laugh. Not used to you laughing.
Okay. You told me not. I'm too serious last time. So I'm laughing this
Yeah.
time.
Oh, what'd they say? Hey, you got to laugh more,
Bye,
you're
guys.
freaking people out. Okay, Doc. See you. Watch
Bye,
hands.
Doc.
Okay. It's 7:35. We'll take a short break. We're coming back with the Department of Public Health and Social Services next, right here on the link. It's The Breeze 93.9. Good morning, Friday.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Coming up, Gayle King's exclusive interview with Facebook's Mark Zuckerberg about the social media giant's new election security measures. Plus, meet a group of teenagers bringing fresh food and hope to their community. Coming up on CBS This Morning.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Half a day. My name is Chimamba Kwem, Tuberculosis Enhancing Disease Program Manager for the Department of Public Health. As Guam continues to deliver critical services during this unprecedented time, we must do everything in our power to protect the health and safety of our people. Continue to encourage wearing a face covering, practice social distancing and washing hands. These practices are becoming especially important as we begin to reopen our great island. Prevention saves life. For more information, please call 311 or check out our website at dphss.guam.gov.
To my island, where they're gonna extend the lockdown. Yep, that was the word out of Crystal Paco San Augustine this morning.
Yep. PCOR 1 Stay-at-home order till September 11th, 9/11.
Wow.
One more week, and it's pretty much going to be status quo in terms of the guidelines and the restrictions. Press conference at 11 o'clock. The governor, Lieutenant Governor Art St. Augustine from Public Health, GMH, Lillian Posadas, and Dr. Felix Cabrera. Guess he's going to have more charts to show us.
And so let's go to the K-Wave News Zoom room, and we'll bring on from the Department of Public Health and Social Services. We have Dr. Ann Poblutsky, the territorial epidemiologist, and Annette Uggan, who is the lead of the Public Health Contact Tracing Squad. Good morning, Annette. Good morning, Doc.
Morning.
Good morning. Nice background.
Wow, Annette, they gave you an upgrade to your office. I'm so happy for you. You're like, you know what, Bust? I'm gonna work outside. That's fine. Where's your background from, Annette?
That's Fiji, actually.
Wow,
it's nice.
Wow, so we're getting charged long distance for this interview, huh? Is that your?
Covering up all my. What was the question?
All right, ladies, and then could we just get we'll just get right into it. As the contact tracing a lead, we're seeing these crazy positives, the testing positivity rate. What's the status, and what can you tell us about who is testing positive for COVID-19?
Well, we're still seeing, unfortunately, household members, which again is to be expected. They are at higher risk. And then we do have some community contacts, be it coworkers, and so unfortunately they're not knowing. We're still seeing asymptomatic individuals not knowing that they're positive and bringing it home to their family, and again, that's how it's just spreading out in our community. We've seen a wide age range over this past week, and unfortunately we've had the recent deaths in this past week, and so we're seeing minors all the way up to the elderly being affected by this. And so again, it's definitely within our household members and our coworkers and friends that we're seeing this spread.
Yes, and if you want the numbers, Stephanie ran the numbers on 1,100 of the 1,500 or so cases and found that 60% have been asymptomatic, 40% symptomatic. So if you're asymptomatic, that you mean you don't have any symptoms, but you might have had a contact with someone, and that's a problem with this novel coronavirus. People can be spreading it without knowing it. That's why we ask people to wear masks and social distance. And if you're positive, stay home, isolate, stop the spread.
But it says my name, not yours.
Huh?
I'm sorry, I'm having trouble hearing what?
Sorry,
no.
we got a Zoom. Somebody jumped in the Zoom and didn't mute themselves. Sorry about that.
Oh, okay.
Annette, so just going back to the status of the contact tracing, we heard from Dr. Wen. He obviously expressed the concerns he had with the lag in the contact tracing. And I mean, I feel like every time we get you on here, we ask you, hey, is Public Health doing okay with the contact tracing? You always say yes. But I mean, I got to ask again, is Public Health up to date with the contact tracing? Are you guys overwhelmed? Do we need to? We had the Guam Nurses Association put out a call for nurses, and Dr. Wen had said that we're looking at some of these GovGuam employees who are staying home, earning a paycheck. Let's get them to work. Is that going to help? Do you guys need the help? Where are we at with contact tracing?
Yes, actually, we put out a call to as our numbers continue to rise, and we were seeing that backlog and being overwhelmed. We were able to get assistance, like with DYA. We were fortunate that we've had 4 staff temporarily assigned to us, like a 2-man team rotation. Dr. Wen also mentioned how Port Authority of Guam, they had several of their staff take the training, and so they were in communication with our team to assist us. GMH helps us with contact tracing at GMH. It's a collaboration there. This effort too with University of Guam and UC San Francisco. We already had our own separate meeting in regards to trying to pilot a team at UOG, be it students or those who just completed the course that will end today, to help expand our our manpower. Department of Labor too has helped us. They received their own federal funding and provided us some personnel who have stepped up to do more than just data entry. They were very interested in contact tracing, and so they've taken the training, had the mentoring and shadowing opportunity as part of our training, and so they've also stepped up to do that. And then within our department, we have across our other divisions who are also taking the training, have started to be mentored and shadowed. Again, like Dr. Wen pointed out, it's you need to be trained, not just take the course online. There's more to it than that. And so those are the things that my staff are trying to juggle. The team is trying to juggle between actually doing the investigation and contact tracing and trying to bring on people. So we do have some individuals too who are doing other COVID-related response activities, like Grace Berdallo, who's our PIO, also comes in and helps like after hours on weekends. We have other staff, again, do their regular duties and come and help us. So that is how we are definitely trying to expand. And again, other agencies too have reached out. The class that Dr. Wen mentioned has a mix of like not only UOG students and nurses, but also we have Guam DOE, we have judiciary. My understanding is also National Guard is there. And so we hope to utilize those individuals to be maybe now our point of contact at their respective agencies. God forbid they should have a case, then we can tap on them and to be an extension of our contact tracing team.
So how far behind are we on the contact trace investigations? Because you just got 74 new ones last night.
Yes, some of those though are within the same household, and so the contact tracing is pretty much done. It's just unfortunate that they went from being a close contact to now a new positive. So that kind of helps us in the workload in that we don't have to re-interview them in regards to if they're minors and just been staying at home. It's just if individuals who are working, now we got to look at your work side as well and see who are close contacts there. Normally, we really try to do our investigations within 24 hours. That's the ideal, as Dr. Wen mentioned, and that's been our goal all along. But as the surge happened, we unfortunately fell back a little bit. We were looking at 2 to 3 days, but our team is catching up on that. They're working into the night, Saturdays and Sundays. This holiday coming up, what holiday? There are plans already to come into work because, again, as we deal with closing out cases, like you said, last night we have 74, and so we have to clear out some, and then we get new cases that are added on to each investigator and contact tracer's assignment.
Dr. Ann, and then maybe Annette too, when you talk about 60% of the cases that you had looked at being asymptomatic, is there any thought at all about, and we always hear from some of the doctors that people are breaking the home quarantine, which I can only assume means they're also breaking the home isolation, or in a lot of cases, they don't have the means to adequately isolate themselves from the other members of their household. And I think we're seeing that with the spike in household positives, like you're saying, Annette. So I guess that being said, do we need to have the conversation about just sticking all the positives in the ISO facility, the government of Guam ISO facility?
Well, not necessarily.
No, you go.
We've had instances where there was a positive case in the household and nobody else in the house became positive, that they took the necessary precautions. They social distance, they took shifts, be it for eating and the restroom, if that was the case in that household. So we've had our success stories that maybe have not been put out there to the media to know, or the public, that we have people who are compliant. We've had some individuals who, because of the situation that they were close contacts to a positive case at the house, that they asked to be quarantined, to be removed out of the house and be quarantined at the quarantine facility. So it can work either way. Then we do have individuals who've asked, can I be moved out into the isolation facility? And so that's what's being accommodated with our containment and infection control branch. And as you've seen, we've increased our capacity for quarantine facility as well as for the isolation facility to help accommodate these issues and not just those arriving passengers.
So no.
Yeah, no.
In regards to sticking everyone into an isolation facility, again, there are some instances where their family members are their main caregiver.
Right.
And so to stick a non-positive case into an isolation facility, that's high risk.
Right.
again, and we're also looking at people's comfort. They're you want to recover at home, so that's a psychological benefit as well. And so we do have those instances where, we're okay. We will just take the necessary precautions. They will be checked on by our isolation and quarantine teams. And then other individuals, unfortunately, it's very difficult for them to meet those necessary self-isolation guidelines. And then we have to make accommodations or see if some of them don't even want to go to the facility, but maybe they have a separate house they can go to, a different family member that they can separate from, or utilize a different home. And so that's something that our team works with case-by-case basis.
Dr. Ann, so we're doing a mass, a limited mass testing tomorrow, 200 people at Talafofo. What are you anticipating we're going to see?
I have no idea. It's quite widespread. We're still seeing that, we have 1,560 cases. We've got the hospital is full. So I assume we're going to see a lot more positive cases, and the governor is anticipating, or at least according to the media, continuing the lockdown. And I think this is good. And I think, the stores are open. People can still take care of, getting food, whatever. But this issue about banning large gatherings is really important, because that's what we've seen with the contact tracing and the clusters is large gatherings, churches, etc. And that's why it's probably a good idea to keep these numbers down by preventing these kinds of large social gatherings, funerals, churches, etc.
When you say churches, are you talking about like the parking lot masses?
I'm sorry?
When you say churches, are you talking about like the parking lot masses?
Are you talking about the parking lot masses when you say churches, or are you talking about some other
funerals? Yes, church gatherings. I don't know what's going on with the outdoor masses or whatever, but we have seen some clusters associated with churches earlier in the month.
Right.
People were talking about significant clusters, and what we've seen, that's one of them.
Before you guys released the name of the church, it was Iglesia Ni Cristo. And I've heard, from different people who know people that go to a couple churches where they were telling me, hey, yeah, there's a cluster there. We haven't heard anything out of you guys. Are we naming the churches? Because we did see that there was a church that was cited last week because nobody was wearing a mask.
This was on August 23rd. This was from Division of Environmental Health, their COVID-19 inspections. And so it says Calvary Chapel, Assen, August 23rd, failed to enforce mandatory use of face mask, failed to have an organization-specific guidance plan, failed to adhere to authorized number for social gatherings, and then failure to adhere to Public Health Guidance Memo 2020-.
Well, it sounds like that's our cluster, huh?
No, we're not saying that. In regards to the parking lot, that's one of the measures that like the Catholic Church has taken to reduce a large number of people gathering in the same enclosed space. So what we're in regards to social gathering, it's if situations like that or other religious groups or organizations where they're still having gatherings of more than 20, 25 people in one big area in closed space, and then they're not following the social distancing measures as well as wearing the mask. And unfortunately, that's where we're seeing the fallout when people don't follow those recommendations. We let our guard down. And again, we think we're safe with family and friends and not realizing, like Dr. Ann said, 60% are asymptomatic. So you think you're okay. I know Dr. Wen mentioned in a previous interview, it's actually through family and friends that they're spreading it because you don't know, and that's how it's going from household to household. Unfortunately, bringing it to your work site, exposing your coworkers, and they bring it home to their family. And that's why it's just this huge domino effect, and that we ask for people's patience as well as their support, and to continue to be responsible as an individual and as a community, because that's the only way we can help each other, because again, we can't do it alone.
All right. Can you just walk us through, and I know you're not with Environmental Health, but I'm pretty sure they put you guys in the loop. So August 23rd, that was a Sunday. All right. And according to this report, nobody was using the masks. So if I'm the environmental health inspector and I stumble on this scene, whether it's, from a tip or What happens when I go in and I see Leche, nobody's wearing a mask, they're not social distancing? Do they like shut it down? Do they tell everyone, hey, go put on a mask? Is it a disperse kind of thing? What happens? Because this is the number one thing we're being told not to do. Don't gather and wear the mask.
Correct. And that's why they've been going out there. As you can see, they've expanded from just businesses to even funerals that they've been asked to check on for those type of gatherings like that, and then to basically inform them of the violation of the executive order or guidance memos, and to have them
So what happens though, Annette? Do they got a boss?
We don't have a public health police force.
Right.
We can't go out there and police everybody. The Physicians Advisory Group suggested partnering with the mayors so that the mayors could do this kind of thing,
Right.
Doing surveillance in their village. But it's really about people being responsible. I believe one of the churches was cited for that, but they refused to comply. We also have that, people or groups will refuse to comply. That puts everybody at risk.
Yeah.
What does the community want to do about it? We don't have a public health police force going out there and doing citations.
Right, but they do citations.
we should,
yeah,
right?
No, I mean they did get cited. So I'm trying to ask is when they bust in and they're like, hey, no one's wearing a mask. Do they make everyone put on the mask and then continue as you were, whatever Bible verse you were on? Or do they just say, hey, you guys aren't wearing a mask. Okay, see you later. Tickets in the mail.
No, we so right now the penalty that they're talking about is those who violate the quarantine order that they've signed, right? So that's the only thing that we've seen and already one case was taken to court. In regards to this, when people are not providing or complying with the social distancing, they're cited, as Dr. Ann said. But after that, our enforcement is just to advise them of the recommendations, to comply with it. And again, we don't have additional authority to tell them,
What about that the public nuisance thing? I thought we could cite people for being a public nuisance.
You could, but we're not the police. We would have to then call in. And that's why this discussion about a recommendation to have like the mayors of the different villages come in and assist us, because that's beyond our public health authority to do that.
Right, but this is the
police, Mayor's Council of Guam.
This is the Division of Environmental Health that's going out and inspecting these facilities, and this is on top of their regular sanitary inspections. And they do have, don't they, the power to
they can shut you down.
Like restaurants, because I know that they've shut down different restaurants when they do their regular sanitary inspections. But it doesn't indicate here like if they were shut down, as opposed to like I get the other ones with the sanitary inspections, and it does tell you like whether they were shut down or not.
And
I don't know if this is new, because I only started getting these like a couple weeks ago.
Right. I just got to break in here, ladies. It's 8 o'clock. We're KUAM FM in Agotni, Guam. Thank you so much to our viewers on KUAM TV 11 for watching. It's the link on the Breeze 93.9. We're currently interviewing with Public Health. We have the territorial epidemiologist, Dr. Ann Pobutsky, and Annette Uggan from the Public Health Contact Tracing. The conversation right now is centering on a local church that was issued a violation from Environmental Health for having a service in which nobody was wearing masks and they weren't social distancing. So jump on over to our KUAM News Facebook live feed and get right back into the conversation here on the link. It's The Breeze 93.9. Thank you so much, TV 11.
The one good thing I think about this, though, is the fact that you know that public health is out there, right?
Yeah,
and they're doing these inspections and making sure people are following the guidelines. So kudos to Tom Nadeau.
Yeah.
And his
I mean, that's the
people.
good thing. But then on the flip side of it, if I'm a church, I'm hearing this conversation right now, I'm like, okay, we got a citation. And they didn't call the cops? They didn't call the cops?
Yes. DEH staff can call the cops if they're not already accompanied with them.
Right.
But as in for DEH, public health, to close them down, that's not that's
Right.
not for us. It's GPD will turn around and enforce that. In regards to the sanitary permits, that's prior to COVID. That's a standing
Right.
enforcement that DEH can enforce and implement. But in regards to the social gathering, DEH can cite them, but then they call in like GPD to enforce that.
Right.
closure.
Yeah,
So
but
again,
when we,
it's not public health doing the
Yeah,
closure
yeah.
for not following the social distancing measures and the guidance memo and the executive order. We call in our law enforcement partners who will then deal with that organization
Right.
to shut it down
But
or
you
to
don't-
comply, as you say, put on the mask.
But Annette, in this case, you don't know if environmental health called GPD.
Yes, they are with. I can't go into. I don't know all the details, but
Okay.
DH is normally accompanied with GPD, and then they can call them in to deal with the, like you're saying, to shut them down or either comply with the requirements so that they can continue on. So yes, they would inspect. They notice the infractions or the violations. Then GPD is the one who steps in and will either shut them down or require them to comply with the measures.
Dr. Ann, I wanted to ask you because there was a story that had come out yesterday about a vaccine. And I mean, Saipan had this story a few days ago where they said they were advised to prepare for the arrival of a vaccine, which, I mean, they didn't have any real details on it. What I know, this is probably something you're tracking. What can you tell us about that?
Well, there's supposedly announcement that there's going to be a vaccine available shortly, but I don't know the details, and I also don't know. I believe it's an emergency use authorization vaccine, but until I hear the details, I'm not going to talk about it. As a matter of fact, we don't even know if it's safe, what kind of trials that they did, because this usually takes a long time.
Right.
But let me also suggest that we should talk about immunizations and COVID-19. We've got flu season coming up. People who are at risk for influenza. We don't want to see a double epidemic going on. I think that's a topic that we can address. And you've got Annette used to be head of the immunization before she got bumped up to head the entire Communicable Disease Bureau.
Yeah.
This is an important topic, and they're gearing up for mass immunization because people aren't getting immunized. Their kids aren't getting immunized. We need to start talking about the flu vaccine before we even get to a vaccine for COVID.
Okay.
Because you certainly don't want to have the flu and then get COVID.
So
and
Annette,
I have a list of other topics that I would also suggest later. Annette?
Should people go out then and get the flu shot during?
That's why I want
during
Annette to
peak
address
one?
this because
Okay.
the Immunization Bureau is doing some plans to gear up for
Outreach.
immunizations for
Right.
kids.
Okay.
And there's some guidelines on influenza as well for elderly people at risk. It's the same story that you need to get your flu shot. And this is coming up here. It's already September. Annette?
And we normally would see a spike in influenza cases in August when schools reopen and and it's rainy season. And so this is definitely something that nationally it's a priority to increase our influenza vaccination. So as Dr. Ann mentioned, we don't want to have both flu and COVID circulating in our community. Some of the symptoms are the same, and so if people we don't want to inundate our healthcare providers and the emergency room. They're already overwhelmed with COVID alone, and so we definitely want to encourage individuals to take that seasonal flu vaccine while we wait for the COVID vaccine to be released. And so again, when Saipan gets their COVID vaccine, Guam is going to get their COVID vaccine, but we definitely need to wait for the details of the safety, the efficacy, and what are going to be the recommended age groups. Is there a minimum age? Like for influenza, it's 6 months, but we still don't have all those final details for COVID. Are we talking about 1 dose or 2 doses for the COVID vaccine? What are the storage and handling requirements? Because that's a concern nationwide. Are we talking extreme freezer storage, or is it something that we can use, with our current pharmaceutical grade freezers? And so that's definitely something that the mass flu vaccine is our warm-up to the mass COVID vaccine campaign that we will push out. We have to also monitor about allocation. Are we looking at limited supplies coming in, in piecemeals, and so that we're going to have to prioritize priority groups, like we did back in H1N1. We have to look at the front line, the elderly, those with medical conditions. And so those are the things that now, while we're juggling COVID response, we're we're ramping up our mass vaccination plan so that we can deal with the flu and then turn around and revise it once we get the final information for the COVID vaccine. And then again, it's going to be a community-wide effort for pushing out the vaccine so that hopefully this can help prevent you from getting it, and so that we can bring down the number of cases that we would have to deal with because now we have the vaccination to prevent it.
And how soon are you going to roll out the mass flu vaccination program outreach?
We're going to do it actually in different pieces. We're going to rely on our public and private partners. We were fortunate enough that CDC gave thousands of extra doses of seasonal flu than we normally would get. And so in the past, we would have to limit. Now it's kind of, let's open it up and give as many as we can. We're going to work with community vaccination partners, be it the private sector, if we can hire some vendors to go out and immunize people for us, while public health also does mass vaccination in the community. Give it out to our healthcare workers to immunize themselves and their clients if they choose. And so as soon as we get our vaccines in, that is going to be rolling out quickly. Again, depending on the stock that we receive, do we have minimal numbers that we need to prioritize, or can we just get a huge supply in and then we can distribute it widely and have many venues for people to take the opportunity to be immunized?
But people can go now to their regular doctor, right, and go get this vaccination, and that is something that you recommend.
If the provider already has it. Public health, we unfortunately normally get it a little bit after the private sector because we get ours through CDC, then it's redistributed out to all the grantee jurisdictions. And so once we get ours, then we definitely will be pushing out to our public and private partners.
How can you tell the difference between if you have the flu or you have COVID?
You might not. You might not. Some of the symptoms are the same. The only way you can know is to test.
Okay.
And that can be done. We can test for flu and COVID and RSV and all kinds of things. So we're trying to get that going as well because, yes, as Annette said, we usually see flu start when the kids go back to school and infect everybody.
You know, Sabrina's been asking this question several of our guests throughout this week, and I guess we'll start with Dr. Ann. We had you on, I want to say, a couple weeks ago, and you had said, hey, I don't even think the kids are going to go back to school this year, right? And now, nothing has improved since that last conversation. We're hearing from the Guam Memorial Hospital that the number of people on the ventilators, at least from our last count, has tripled. That, the hospitalizations, as predicted a couple weeks ago, continue to surge. That being said, the question that Sabrina has asked our guest, she asked former Governor Carl Gutierrez this just yesterday. Are we going to be okay?
I don't know. I think it'd be good for you guys to have someone from DOE come on the show and talk about what their plans are. New York kids have gone back to school because they had that huge surge and it went down, and they're doing a lot of mitigation. So it could be that we give every kid a face shield and have them decorate it with their name and, I don't know, plexiglass, social distancing. I don't know what the DOE plans are. I also don't know what the governor has decided to do, but it's really important for kids to go to school. Maybe they're going to do online learning. I don't even think UOG is open yet. So this is not my call, but there are things that the DOE is probably planning, and I think it'd be good if you guys do a show with them and see what their mitigation plans are for bringing kids back to school once that might happen.
Yeah, Doc, we do get them on every week, but I'm speaking more generally, with the spike in the cases and everything else that we're talking about this morning. Do you think the people of Guam and the island of Guam is going to be okay?
I don't know.
We're a resilient island. Our people are strong. We will bounce back. We again just need to pull together. The numbers are still high this week, but it's not as high as last week. So hopefully that's a small glimmer of hope. And again, if we continue to do the social distancing and stay home if you're sick, cover your cough, wear your mask. don't go around if you're symptomatic or if you think you've been exposed. Get checked if you think you are or you have symptoms. Those are the ways that we can help, bring that, flatten that curve. But again, we don't have as many cases as we saw last week. It's still too early to say. We're, to open up more, reduce restrictions and open up more things. No, it's still too early to say. But at least our numbers are slowly going down. It's not low like where we would like it to be, but our people have complied in the beginning when we did lockdown in March, and we saw that we flattened that curve. So again, we can do it, and our people are resilient, and we will persevere through this. And so we are getting assistance through from the federal side in regards to GMH. And so again, that's where I know Dr. Wen also mentioned, if someone's feeling sick but it's not urgent, don't go to GMH. Go to a private clinic and get seen, because GMH is overwhelmed as is.
Thanks, Annette. We do have a question from one of our viewers, and I think this question has been asked in the past, but Melanie Untalon is asking, if you were positive with COVID, can you get it again, or are you immune?
It's possible.
Yes, it's possible.
We have heard, this was last week, we talked about out of 24.9 million cases on the planet, yes, they're seeing people who may have been reinfected. But again, the science seems to suggest that you will develop antibodies. And so if you do get it the second time, maybe it won't be as bad as the first time. And we really don't know. They're working on this. Yes, there's several cases of people who have been reinfected. But the science seems to suggest that people do develop antibodies to the virus, and that when they get it a second time, it might not be as bad. And we don't know how long those antibodies will last. Coronavirus is likely to be around with us, all of us on this planet, for a long time, which is why we need a vaccine, and we need the scientists to really look at. There's not just one coronavirus. There's hundreds of them. Mm-hmm. This just happens to be one that we haven't been exposed to, and that's why it's called novel coronavirus.
Yeah. Annette, I just had maybe a last question here, and it involves military positive cases who come into contact with civilian members of our population. So I know somebody who had contact with a positive case that's serving in the active duty military on Guam. And when this person had contacted public health, they basically were told that they can't contact trace on the military side. So, and just to clarify everything, if I'm, for example, if I'm in the Navy, all right, and let's say I'm dating a local girl or, whatever, a local guy, I pop positive, what's the protocol for the people I come into contact with who are not under that military umbrella? And then what authority, if that's the right word, does your department have to, again, across the fence and fold in that part of your contact tracing investigation? Because I remember back with the airmen, you had told us that there were issues that you guys had with trying to conduct your contact tracing in terms of you conduct it, but you hit that roadblock when you hit the military fence line. So just a status on that.
So again, we still partner with the military, both Naval Hospital and Anderson Air Force Base. We actually have a weekly call set up to discuss and give each other updates in regards to cases that cross the gate, right? So if an active duty member is positive, that is handled by the military. If they live on base, they take care of their contacts, the household members and on base. If there's residents who live off base, local residents who live off base or been in contact, be it because of work exposure or because they're identified as close contact by having get-togethers, then the military will notify public health, and then we will work with them to do those residents who are outside the gate, and we've done that in the past. And again, we rely on the information given to us by cases, be it military or a civilian. what the information given to the contact tracer is what the information we go off of who are identified as close contacts, and we will investigate that and reach out to those individuals. So if we're not informed, and again, this is something not just for the military, it's even if it's a civilian individual, if they do not want to be open and cooperative with us, we're going to go off on the information you provide us. And then unfortunately we do get calls from other people saying, no, I know this person is positive, and how come I haven't been called, to find out they weren't named. And so unfortunately, that's how we will work that angle. We will work with that individual who's stating, yes, I was exposed to someone who was positive, and then we will interview them and set them up accordingly for testing as needed, to advise them also of quarantine if it's needed. But again, we rely on the information reported to us. Same thing for the military side. They rely on the information given to them by the case. And then we have a joint information, a sharing of information saying, can you guys handle these individuals because they're outside the gate, they're local residents.
Well, we're going to wrap this interview up, but, we're heading into a 3-day weekend. I think it's Labor Day, I think. Dr. Ann, is there anything you would like to say? Because, like I said, it is a holiday weekend. We still have knuckleheads out there that think it's okay to go and, party and whatever. So is there any parting words you have? Any message to the community?
The message is the same. Don't have any large parties. Don't go to church. Pray to God on your own. Wash your hands, social distance, wear your mask, keep your family safe. Yes, the governor said it's okay to go to the beach. If you're in a small group and the kids want to play, that's fine. Don't go join 50 other people. Basically, don't have any large gatherings and keep doing what you're supposed to do. Be patient. This is not over. We don't want to see people coming to the hospital. The hospital's full again. We don't want to see it. We don't want to see people going to the hospital. And if you have a chronic disease at any age, or if you're elderly, be even more careful. And I think that's another topic for your show. Talk about chronic diseases and COVID, people at risk for severe reactions and death. And let's think about some other topics. You can also deal with social determinants of health and COVID, disparities in COVID, health literacy and COVID, and you might want to even get some of the faculty from UOG on some of your shows. Talk about the College of Tropical Agriculture, why gardening is great in a pandemic. You can grow your own food.
Okay, Doc.
Climate change and why we are seeing this kind of virus during this time of global connection and deforestation and the ecology and the environment. Get some other topics, not just our day-by-day, play-by-play of what's going on.
Well,
People know what they need to do. The community is not stupid. They know what to do.
There you go.
Well, Doc,
thanks, Dr. Ann,
Yeah.
the territorial epidemiologist / executive producer for the
topic.
link.
Hey, Dr. Ann, can you give your list of topics over to Annette, and then she could WhatsApp it to me, and we'll send you a small check for your input.
Very small.
Very, very small. Very, very small. About as small as a coronavirus.
Okay.
All right. Thank you, Doug.
Thanks.
Be safe. Annette,
Yes, sir.
Thanks, Annette.
thank you for bringing us to Fiji this morning.
You're welcome.
And be
Thank
safe.
you, and be safe as well. Thank you.
Okay, wash your hands, all right?
Yes, and wear your mask, social
I am.
distance.
Always. I'm even matching today.
Get some rest.
Right. Okay.
if
Annette.
that's even possible.
All right, 8:19. Hey, we got to take a break. We're coming back with your village mayor. That's right, your mayor is going to be on the link, the Breeze 93.9 at 8:19. Good morning, Guam.
Where's the best?
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Yep, there's two things Shamars like to say, I know, and then if they start the sentence with you know, that's when you know you better look out, because that was my grandma, you know. Oops, so here it comes. 8:23, it's The Link on the Breeze, 93.9. Proudly brought to you by First Hawaiian Bank and Calvo Enterprises, ITE. Let's go to the KUAM News Zoom room. Here's what's coming up, though. At 8:45, we'll talk with Sergeant Paul Tapau of the Guam Police. We'll go behind bars with Major Antone, Department of Corrections, and then we'll close out the show with Bear from Vince Bear Kittigawa from Show You Roll. Breeze out in
California.
That's in the States, so yeah, he'll be talking about
just catching up with him, linking up with him. You know, we had Drew Murphy on a couple weeks ago. You know, that's what the show's about. It's The Link, linking up with people here on Guam and linking people up in the States or all over the world. So there's also one person I'm really trying to get in on the show. You know, Sonia, because, you know, we keep in touch, and, you know, she's over there in Hong Kong, and so I'm trying to hopefully get her on next week.
Talk about a much-needed ray of sunshine.
Yeah,
she would be awesome. That would be a ray of sunshine for everybody.
Yeah, Sonia Artero Dias.
Super positive.
Yep. So we'll work on that. 8:24. Hey, also set up for next week, someone you can look forward to having on the show. We're going to get Tom Nadeau from the Division of Environmental Health to kind of go into not just the regular inspections that they're doing, but these COVID-19 inspections that have also become part of their responsibility, well, yeah, since the COVID. So 8:25, let's go to the KUAM News Zoom room where we have a few village mayors standing by. I know Mayor Rudy is jumping in, but he's coming all the way from Gigo, so we got to give him a little bit of time.
The other Mayor Rudy.
The other Mayor Rudy, that's right. And so we have in our Zoom room, we have the Mayor of Barrigada, Mayor June Blas. Good morning, Mayor.
Good morning. Half a day. Buenas.
And we also have from Mong Mong Toltu Mighty, like my friend Andy Wheeler likes to say, the greater Tri-Village area. We have Mayor Rudy Paco. Good morning, Mayor.
Good morning, sir.
And then from the village of Jotnia, where everybody knows Jotnia rules, we have Mayor Bill Kenga. Good morning, Mayor.
Good morning.
Well, thank you guys for coming on the show. I wanted to start with have any of you all heard from the Essen mayor, Frankie? We've been trying to get a hold of him. We just want to make sure that he's doing all right. Has anybody heard from him?
He's recovering pretty good.
Yes.
That's good. That's good to hear.
Yeah, he's recovering pretty good.
Excuse me, something's wrong with my volume, okay?
It's okay. So let's just go down the line. We'll start it all the way in Jotnia. How are things going in Jotnia?
Pretty good up here in Jotnia. Everybody's practicing the safety for about this COVID. Yeah, we're taking the extra measures to make sure everybody's staying safe.
Barragata, Mayor Blas.
Hi, good morning, Bree.
Good morning.
Well, things are slow. I mean, we try to enforce and let our residents know to please stay safe, stay home. Don't you don't have to go. Things are doing well. We continue to do our work and practice safe distancing. That's for sure.
Mayor Paco, we heard you earlier. You were making breakfast for Crystal when she was on our show. Just kidding. How are you doing?
Negative on that.
Wait, she said she didn't cook. She doesn't cook the last time she was on the show.
I think they're old enough to fend for themselves.
So how are things going in MTM?
We're doing pretty good in MTM. I guess people are just getting sick and tired of hearing the same old wear your mask, social distancing, and washing your hands. The biggest issue that I'm having here in MTM is speeders, people driving fast, and the prowlers that come out in the wee hours of the morning, looking for things they can easily grab from people's homes.
That's sad to hear, Mayor, that the Sakis are not staying home.
Yes, that's right. The Sakis are not staying home.
Let's talk about the speeding in the village, the common problem in a lot of villages. Mayor, where are like the trouble areas in your village? And before you get that, we're going to bring on Agate! We're going to bring in Agate Mayor.
Agate's in the house.
We're not going to have any issues with Jotnia and Agate on the same Zoom, right? And we have Agate Mayor Kevin Suswico. Good morning, Mayor. We'll get right to you, but we're with Mayor Paco now. Mayor Paco, where are some of the problem areas where people are speeding through the village?
I have a lot of complaints in J. Camacho Street. There's speed humps, but they just disregard it and fly over it. We have a lot of issues in Biang Street and as well as Roy T. Demian Street. I have emailed Chief Ignacio twice to see if they can put speed traps around the community, but I guess they're all tied up. Either they're short of manpower or they have other things that they need to attend.
Mayor Suswico, good morning.
Good morning.
Good morning.
Good
How
morning.
you doing?
Good morning. Alfadi from Agate.
Right on, Mayor. Loving that shirt too.
Thank you.
We'll just start.
Too bad we missed the Mango Festival this year.
Right, I know. Yeah, it was like the first big event that was canceled because of COVID.
Absolutely.
We'll just start. We asked the other mayors, like, what are some of the biggest issues facing the village of Agate right now? What are your constituents saying during this lockdown as we're looking at it's going to be extended for at least another week?
It's my hopes that, the community is actually, taking it pretty well and actually, being outside of the house at night. It's kind of interesting to see and hear the village quiet. For Agate to be quiet, most especially on the road, the main road that I live on. One, it's reassuring to me that, people are actually trying to stay indoors. I don't hear the loud music at night, and I don't see people barbecuing, which is a great sign that, people may actually be taking this quite seriously. And we remind them every single day, that we need to do our part. In order for us to clear this pandemic, we must do our part together and get through this as one.
Have you guys heard from the Physicians Advisory Group, or maybe even the president of the Mayor's President of the Mayor's Council, Melissa Savaras? Because I know she's had discussions with Dr. Hoa Nguyen about engaging the mayors to help be the eyes for enforcement, for making sure that people are following this stay-at-home order, this PCOR 1, this lockdown. Have you guys heard anything about this? I'm not supposed to say snitches, but
Sabrina.
Yes, Mayor Paco.
Yes, the thing about this is we've been requesting public health to give us the names of the individuals that should be homebound, that tested positive, but according to them, it's the HIPAA Act.
The anesthesia. Yeah, they can't give you guys the names. How about have you asked for addresses or any other type of?
But in answer to your question, no, we haven't been contacted by the board, and I don't think that Mayor Melissa has told us anything with regards to assisting with constituents that may or may not be adhering to the order. Mm-hmm. I haven't been informed about it.
How about you, Mayor Kenga? What about the people of Jotnia? I mean, are they taking this serious?
Yeah, you got the elders but the young ones are just taking for granted for what's going on right now. So I try to talk to them and let them know that this is very important pandemic. I mean, you got to stay away and make sure you practice your safety, but a lot of them don't listen, But I still try and talk to them and talk to everybody around Zonia about staying safe. Mm-hmm. And practicing the safe distance and all these good things. Mm-hmm. This is something that it's not a joke that not to take advantage of.
Mm-hmm. Mayor Kenga, so when you talk to them and you say they don't take it seriously, what are they saying to you?
They say, don't worry, I'm out in the sun, and all these kind of things, and they're hanging out sometimes at the stores with their buddies, and I always tell them, you guys got to stay away, you guys got to stay home, you got to listen. Mm-hmm. And their attitude, sometimes they just don't want to listen, but I try my best to try and make them understand what's going on.
Mm-hmm. I'm just curious, you, since this whole COVID, you guys, your responsibilities seems to me have increased. You're distributing food at your offices, and then distributing food to our Manumco. You're being asked to watch for these violators. You've just got the recycling revolving fund money, so you're doing COVID, you're doing everything else that you're supposed to do. Are you guys getting any sort of support, like PPEs or anything just to do your jobs and beyond?
Other than gloves and hand sanitizer and God be with you.
Matt.
Well, that's it.
We're now also being asked to assist Sabrina with DOE, to with the different projects, whether it's to help in with the facilitation of the distribution of commodities, or the fruit distribution, or even now for the packets, for the hard packets for the distribution for the students. So, our office, we're still essential and we're still here, and the people need to know that the mayor's offices, even if it says closed in the front door, we're always here, trying to make sure that everyone is safe, and that we're still doing everything that's in the best interest for the people that we can do.
Mayor June?
If I can add on that, as first responders, we continue to work since day one when they called in for COVID with this pandemic. And we continue to serve our people to the best way we can. We have been working with, everyone in departments to just try to assist our people with even the delivery of the Manamco foods. We do that too on a daily basis. And then now that they're bringing up the food distribution for, to the mayor's office, that's another assignment that we have to take on ourselves. So we're doing our best to keep everybody safe, talk to our residents to please stay home if they have to continue to practice social distancing. And so, of course, we do have our parks and our facilities, but we see them, but we tell them that they can't social gather. And doing any work, biking and exercising, those are acceptable. But when you start having gatherings of more than 10 or even with families, that is very alarming. And we try to work together, even as mayors, as colleagues, we work together as one, to speak together as one, and whatever we need, we work together. So we've been here and we're going to continue to be here for our people.
Mayor Rudy?
Where's Mayor Rudy?
Yeah, Rudy?
I think he's cooking our breakfast.
He's delivering it.
Sunny side up, crispy bottom.
There's Mayor Rudy.
Mayor Rudy, I wanted to ask, with they've extended and they are going to keep extending the contract for the homeless shelter at the Global Dorm in your village. Have you been receiving any type of feedback about the facility or, the traffic with the homeless individuals there at that place, Mayor?
Which Rudy?
Mayor Rudy Paco.
Just call me Paco.
Okay, Paco, the one with the homeless shelter in his village.
There's two Rudys.
Yeah. So Mayor Paco, have you been getting any feedback at all about the homeless shelter in the village of Mighty? Because I go by there a lot and I see people, going around and all that.
Negative on that, Chris. In fact, when they first brought the homeless into MTM, the thing about it, I was never informed that they were going to house them over here in Mighty area until after the fact.
Crystal didn't give you a heads up?
No, she did not give me a heads up.
Sorry. Was that awkward?
Oh, they connect.
What is that?
Somebody
Crystal doesn't share her what she knows about the government with me because we're both in the government agencies together.
Right.
So what I do in the community of MTM is what she does down at the government office. Is sometimes it's so difficult for me to get answers from her.
And I bet a lot of your colleagues on the mayor's council, I guarantee you, Mayor Paco, they're always hitting you up saying, hey, go fen ask Crystal what's going to happen with the lockdown, or hey, go fen ask Crystal this and that, right?
That's very true, but she never gives me any answers.
How's your staff doing? Are they all well?
Are they burnt out?
Anybody? Yeah.
Have they been getting the hazard
doing
pay?
pretty good. In fact, we got tested last week, if I'm not mistaken, Tuesday at American Medical Center. I brought all my staff up to get tested, and lo and behold, we came out negative.
All right, and let's go down the let's do a status check on you guys as a staff because again, you guys are the first responders, but the staff, I see them all around, all the time, delivering meals, like you said, coming into contact, very much at risk.
Seem overworked.
And also, are they getting the hazard pay,
COVID pay,
the COVID pay, or whatever type of pay that they're supposed to be getting? Go ahead. We'll start with Mayor Kenga.
Yes, the staff has been working really hard up here, and they're doing an outstanding job. And yes, they are practicing the safe distancing, wearing their gloves, their masks, whatever, whoever comes around them, and always make sure they're practicing safety. And with the hazard pay, yes, they are getting the hazard pay.
That's good. Mayor Kevin?
We try and do our best. We them with, like I said, the gloves and the masks, and each vehicle that they're out there in has hand sanitizer, and we encourage them again every single time as far as the social distance is concerned. But what really gets me is that even though we're delivering the food, we don't know it could be on our clothing, right? And so it's still a concern with this COVID that without the right equipment or just one wrong move, you didn't know that somebody sneezed around you and you just so happened to touch it on your forearm, and it's transferable anyway, right? So we can keep telling them to do the right thing and to be safe, but really our staff put their lives at risk every day, and they're doing such an outstanding job for all the mayor's offices, for them to be out there, and for us to do what we do every day. It really shows a lot of the type of characters that these individuals have for the employees that work in each municipality. But yes, they are getting the COVID pay, the 10%. It's not much. I wish it was more. And I tell them every single time that they see it, their checks every other week. I always just tell them, just be happy that at least you're getting something. I know that money is that's not the right amount to be the right amount to put your life at risk every day. Just know that they're doing it for a good reason, and it's for the people that we serve. And I always remind them that to just keep that in their heads and their minds and hearts, that it's all for the good of the people that we serve.
Have y'all gotten any of the CARES Act funding? By any chance? Have you guys gotten any of that CARES Act funding? Remember that big chunk of money that we got? And they were, there was a whole budget on. Yeah. It's going to go here.
It's 118 million.
Yeah.
Yeah. Did they give anything for? Because I'm thinking there must have been some money there for like rural or, municipalities. Has Adaloop kicked you guys down a good chunk of that money, or Todd's it?
I hope it's coming.
Did you hear it was
So
coming?
I don't think we received it yet. I could be mistaken.
Did the money take a left, Mayor June?
It took a left.
That's Sarasota.
Take a left, Jalu. Take a left.
Took a left, Chalo. No, what have you guys heard about this money, and what's the holdup?
You don't know about the money.
You haven't heard whether you guys are getting anything.
Wow.
Yeah. You're right. I don't think I saw Mayor's Council of Guam on the tentative budget list. But you would think you guys are on the front line just as much as other agencies and other people are on the front lines.
Let's bring on Jigo Mayor, Mayor Rudy Matanani. Thank you for joining us, Mayor. Good morning.
Good morning. How are you guys doing?
We're doing pretty good. We were just asking about the CARES Act money. They got $118 million.
Yeah, months ago.
Yeah, months ago. We got to do another update because remember last time they had only spent a certain amount of it and they had a whole bunch left. So let me just ask you, Mayor Rudy, do you think that the village mayors should each get a chunk of this CARES Act money to do what you guys need to do to protect yourselves, protect your staff, and protect your villages?
Oh, definitely. We need as much money as they can give us. I was just kind of hesitant to talk about that because I don't want to be criticized, about getting paid extra money for doing the, our obligation and trying to keep the villages safe. I heard that, when you guys were talking to the mayors from the south about the flooding issue, it's very fortunate for Jigo because every time we get showers like that, Jigo suffers in certain places. Like one of the hard hit places here in Jigo is in East Gajanero. I don't know if you've ever seen how flooded that side is in Jigo, and it gets really, really dangerous because at the lowest point of that flood, all the way to the front of the highest house there is about 100 feet deep. There's no current, but there's a lot of water. And also in Berdalio subdivision, when I first came in my first term, we had to rescue 4 kids, from the flat family, the Cruz family over there at Berdalio subdivision. But as far as just rain is concerned, we're okay up here in Jigo. But and something different that happened in this last week with all the rain that was pouring. There was a lot that was pouring up here in Jigo. But let me tell you that there wasn't even an inch of water that was, overflowing down at East Cajanero. And that's kind of weird.
What's weird is you're not riled up about what's going on.
What's that?
Nothing.
Yeah, we're just used to seeing you a little more fired up. Ask the vice speaker.
Oh, hey, you know what happened with?
Yeah, Mayor, we're just playing. No, we don't need to get back into it. Please don't.
It's nothing personal.
Right? Yeah, of course, Mayor. Mayor Kanga, let's go to you. Let's say that Go ahead, Mayor.
That's just maybe a little misunderstanding, and they caught us when we're really, up in arms.
Yeah, it is what it is. Mayor Kanga, let's say for you, for example, if you got the CARES Act money, what would you use it for in the village? Because remember, it has to be COVID related.
Oh yeah, of course, about the flooding issues and all this kind of stuff. A lot of people are complaining of their flood, and also for the Maramcos to find a place for them, like if their place is really flooded, build a place up here in the village for them to get away. And there's a lot of things you can use that money for, Jason. I mean, Chris. I'm new to all of this right now, and I can't answer too much of that right now.
Well, let me ask you something I hope you can answer, Mayor. You're new to all this. You ran in that special election. You got elected, and now we're in the middle of this big fat pandemic. What's that been like for you? Were you prepared to come into this office and deal with all of this?
Well, to be honest with you, I wasn't prepared for it. You're never prepared for anything unless you go out there and try. So I'm here today. With this pandemic, it's a total shock to me. So with the help of my staff and with the help of the other mayors guiding me along the way, I'm grateful for that. And I thank each and every one of them. And it's been happening, and I've been doing really good on behalf of everybody's help.
Right on. I know that Sabrina had asked about Mayor Salas of Asin at the beginning of the call, but we did get a couple more comments. I know you guys have said he's recovering fine, but who's the closest here with Mayor Salas?
Pardon me?
Who's the closest one here with Mayor Salas that can tell us how he's a little more about how he's doing?
I think we all have a good working relationship with Mayor Salas. The last I spoke with him, he was in good spirits, and he was I believe he's doing a lot better. So we just continue to pray for him and all those that are affected with COVID.
When he tested positive, Mayor Kevin, was there any stress, any anxiety from the other colleagues on the council, or maybe even the staff?
I know for on our side, of course, we've been gearing up with this. We meet with our staff every morning at 7:45 for a briefing. And as the news came out, it was a shock to us, and it was a reminder to us that any one of us could get it. And, we're not immune to it. If the governor, the lieutenant governor, and even one of our colleagues, the mayors, could get it, it just really showed and it put what we've been saying, to our staff every single day, that we must practice what we're preaching to everybody. It was a shock because it hit home, and that's too close for one of our offices to actually have it. And so for us down here in Agate with our staff, it was a constant reminder, and it still serves as a constant reminder that everything that we're doing out there in the community, it could affect us, again, and we try and take every single positive outlook from it and move forward and try to do things where we're more careful and cautious about what it is that we're doing out there. It could have been any one of us other mayors that got it, and it just, God forbid that one of us do get it.
Right.
And so we pray for one another during this time.
Mayors, we're just going to go round robin. Closing statements for the people in your village. We'll start with Mayor June Blas. Message to the people of Barrigada.
Well, to my message to our people of Barrigada, we want to let you know that we are still here, our office, to support you in any needs that you have. Please give us a call. We continue to ask of you also to please practice social distancing and also to please stay home if you have to. We don't need unnecessary people out on the roads, and that, we really want to fight this together. No one deserves this. This is something very unplanned. Nobody knows, but we want to make sure and ensure that you are safe. We really care, and our people to please practice and stay home and be safe.
Mayor Kenga.
Yeah, message to the Zona people. I'd like to say thank you for your understanding and patience for any concerns that you guys have, especially at this time of this pandemic. We'd like to ask you to please stay safe, practice social distancing, and may God bless you and your families and each and everybody around the world also. May God bless you all. Thank you, Zona people, for your understanding and patience again.
Thank you, Mayor. Mayor Kevin?
Well, on behalf of to our dear people of Bagot, on behalf of the Vice Mayor, Chris Farron, and myself, we want to, of course, let you guys know that we're here for you. Our office is still a phone call away, and we're trying our best to keep everyone safe. For our Manamco, we remind you to please stay indoors and please practice all precautionary measures because even though we want to see you at the senior centers, we get a call every single day, from a Manamco that miss us. We just want to let everyone know that we're thinking of everybody during this pandemic. We just really want everybody to ensure that, one, you're safe and your family's well-being is well taken care of. And if needed, we're here for you, and we're praying for everybody, and pray for us as well, that we can all get through this as one people.
Thank you, Mayor Kevin. Mayor Paco.
Yes, sir. To the community of MTM, continue to practice your in other words, don't put your guards down, please. Always be prepared and think of the safety around you. And as well, when you do go to the store, please do not take your whole family with you, right? Make a list, get what you need, and then head back home. Our office is open as well from 0800 to 1700.
Thank you, Mayor.
Thanks, Mayor.
Mayor, you okay?
Pardon me?
You all right?
Okay.
You all right?
Yeah,
Okay.
I'm fine.
Well, thank you, Mayor Paco. And last but definitely not least, Mayor Rudy Mazzanani.
Sabrina and Chris, first of all, I want to thank you for, always trying to keep the community, in the loop of what's, everything that's happening here in our community. And I just want to let the people of Jigo know that you have a mayor's office here, and we're always willing to lend a helping hand, all the time, no matter what time. We're open to it. I'm working 24 hours, and I want to always remind the people to, practice social distancing, always wash your hands and keep your mask on. And just always keep safe, and, always think about keeping safe and not after an incident happened. This most especially ever since this coronavirus started. This is an animal that we can't see and is not friendly to anyone. So we should always remind each other, you know, the Jigo family, that we should work together in trying to make our community as safe as possible for the elderlies and the kids and for everyone for that matter. So, you know, and to all of you mayors and vice mayors, please always think safety and continue to practice what we need to practice to defeat this this disease that we cannot see. And God bless everyone and keep safe.
God bless Jigo. Mayor Rudy, just one last question. Are the stray dogs staying home?
Well, they're still as naughty as can be, you know, and there's still a lot of trash when we, you know, that's two of my biggest problems
I know.
up here is the stray dogs and the trash. And, you know, that's one thing that people, you know, every family here in Jigo and any village for that matter, be responsible for their trash. It's really bad, Chris and Sabrina up here.
I know.
And sometimes I don't want to drive into Ramirez Street, but you know, I have an employee that stays in there, and she tries to get the people, you know, together to clean that place up, but it's just getting worse. It ain't getting any better. And you know what? I'm sure glad that you kind of joke with that, Chris, because you know, I want to let the government know that it's our responsibility. This is our responsibility because the people, you know, unless you work on a law that people can respect and so they can take care of their own trash, because a lot of these trash that are in Jigo are not residents of Jigo, man, and it's
imported,
hard
right?
to
Yeah.
keep track of.
Yeah.
But you know, I hope that this government, you know, comes up with a program, because you know you know what started this, what made it worse is when they closed the northern
transfer station.
trash. Yeah. It just got really worse. So, and I was under the understanding that there was going to be another, they were going to construct another trash collection area here in between Dedido and Jigo, but it's already been maybe a little more than 5 years, and you know, it's done a lot of damage. And no matter whose fault it is, it's us, it's our fault, it's the government's fault. And you know, there's a lot of important things here in the government on the island of Guam, but this is one of the most important, and it's our obligation.
I'm almost hesitant to ask you your reaction to that $500,000 appropriation out of the recycling revolving fund. I'm sure you guys are aware of that, and giving it
The 500,000
Yeah.
that they're asking to transfer to Department of Education or
Oh no, this
UOG.
is the 500,000 that's going to the 3G.
Yeah.
Senator Amanda Shelton's is it her amendment, right?
Yeah, to give it $500,000 to the group out of UOG that her brother is in charge of.
You know, Chris and Sabrina, I have a lot of respect for the senators and even all the mayors. Okay, when we think about taking money away from a program that's as important as cleaning up our island, I really disagree with that. And you know, I know we all need money, but there's a reason why that money is there. So let's use it the way it was intended to be used. And you know, I think that it's their program and what they want the money for is important. But hey, it's important where it's at. So leave it at that, and let's use it the way it was intended to be used.
Thank you, Mayor. Thank you. Before we let you guys go, I wanted to Mayor Kev. Yes, go ahead, Mayor Kev.
you know, it's not the fact that we're not in support of the G3 initiative. I think that all the mayors are in support of it, but you know, on a budget crisis, as we are seeing already, and we're already foreseeing for the next fiscal year. You know, this year we only received nearly $500,000, 400 and something thousand dollars that were split amongst the 19 municipalities, and that was not enough money. It wasn't enough money for us to remove all the abandoned vehicles, to clear the illegal dumpings, to remove the electronics, the rubbers, and you know what? People are saying it's true and it's right. It's the people that we need to start taking responsibility, and you know, that those people that are actually going out there and illegally dumping, there needs to be something more in place that is a lot more harder for fines, because it's very difficult for us to keep doing what we're doing, and then for something like this to happen where there's money being removed from us. I can maybe understand if there was an overage or a surplus of money that maybe we're not using in the village levels to clear it. But for just giving us, maybe during this time, we've just felt it with this $500,000 that we had. And we're all struggling to try and get the vendors we're all racing in to try and get increases for the different municipalities so that we can all assist with our municipalities. And $500,000 is a lot of money.
Mm-hmm.
So again, it's not the fact that we don't agree with the G3 initiative. We do agree with it. But please, before you take any money from the Mayor's Council or from EPA or from the program, as Mayor Rudy said, allow us to do our jobs first, because without that money, we're not able to remove the abandoned vehicles. We're not able to remove the tires or refrigerators or etc. You know, it just makes the job a lot harder. And then the people, they don't understand that. When we tell them that, you know, there's no funding for it, it's the mayor's fault why we don't have the funding for it. Mm-hmm. So please ensure, for the senators that are listening, please ensure that, you know, when removing funds like that are very, very important to our municipalities and to the jobs that we're put to do, that you consider the end result, because without us to remove those, and the question was asked as G3, are you going to, with the $500,000, are you going to come out and assist the mayor's office if they're shorthanded or their lack of funds to remove these? And it was
sorry, I thought you were telling a joke there, Mayor.
Please, before any money is removed that is very in dire need for the Mayor's Council of Guam to do its operation, please think of the bottom line, think of the municipalities and the people that it will affect. It's the end result is the people. It's not the mayors that will be left with it. It's the people. It's the people that are going to have to see, like what Mayor was saying, in East Gajanero Road. Mm-hmm. It's the people on Route 2 that are going to have to see these vehicles or these illegal dumping. This is going to be the effect if we don't have enough money to remove these items.
Yeah. I think what really sucks is that you guys have been waiting, right, for these rules and regs to be approved for so long.
Yeah.
And then finally it was approved. The program just started to roll out this past few months. And then all of a sudden, money's already being taken from it.
Mayor June?
It's really unfortunate that happened. But, you know, we just need to do what we need to do. Money shouldn't be taken out of the Mayor's Council, especially for that purpose. But we know we work with what we have, and giving it towards the end of the fiscal year even gets harder, because that's all the monies we got. But hopefully with this next fiscal year that we have more monies to help and clear up our village, because there's only so much. There are 19 districts, and, you know, I'm one of the larger districts. So, you know, we want to all work together, but we need our people also to please, you know, take their trash and put it where it's supposed to. You know, these things that you put on the side of the road, it's you know, going into our aquifers. And it's really sad, because, you know, we drink out of that. You know, they purify them again. And we want to, you know, get our villagers clean. And so we try our best, especially in our village. And I also give thanks to my vice mayor and my staff. They're always out there, as well as, you know, myself, trying to make sure we ensure our people remove all these junk vehicles and help our residents as well. But with these these trash that are left on private properties, we can't just go in. We need to respect them and also find out and who did it, because we can't just keep cleaning. We might as well be solid waste. We might as well be all that. And we have a lot on our hands. We take care of a lot of our peoples too. So, you know, my colleagues, you know, we stand together and we work together as one.
Let me read this. You know, I don't want to get partisan, guys. Don't shoot the messenger, but the Republican Party came out with a release yesterday. Senator Amanda Shelton's underhanded efforts to raid the recycling revolving fund to fund the G3 initiative at the University of Guam was not only a conflict of interest, but questions the integrity of many of our senators who supported this deceit. The G3 initiative is run by her brother, and other than funding off-island trips and the hiring of political puppets for this program, they haven't even provided a plan on how they're going to spend the $500,000. So this release, they're basically saying, take the money back. Yeah. Mayor Kenga, you agree?
Wow.
What do you guys think?
They're saying that out of the 2 million, the mayor's council will get 1.3 million, and that should be sufficient enough. But I'm already saying that here we're trying it right now with 19 municipalities with 500,000 this fiscal year. And this fiscal year, we're all trying our best to go in there right now and clear up as fast as we can, using the same vendors, trying to do our best with 500,000. And the 500,000, from what I'm told, is not even enough. And I'm hearing it from every single one of my colleagues that it's not enough. We don't have enough. From the tip of the island down at Molesto all the way up to Jigo, it's not enough money. And the money is not going into our pockets. The money is just going back to vendors that are helping to take away all of these items. And so 500,000, and yes, we're granted, and thank you. You know, as Sabrina said, right? They finally gave us the funds, but then before they could even give us the funds, already they're starting to tap it.
Yeah, they had to take a little off the
1.3
top.
million may not be enough for next year. And there's really no guarantee that it could be 1.3 million. That was my question, you know, is that 1.3 million, is that even sure? Right? I mean, they're getting this money is coming from the renewal of the vehicles, but we all know that their renewals have been pushed back. Some vehicles don't have to be renewed because of the pandemic until next year. So what ensures us that money will actually be near 2 million?
Right. Mayor Paco, you look like you wanted to say something.
No. I didn't want to say anything. Okay. Wait, just a minute. For the registration, if they're deducting the funds for abandoned vehicles, white goods, and street lights, let's use the funds for what it was supposed to be used for. Give it to a different government establishment. Let's use it for what it's meant to be used for.
Thank you, Mayors. We got to run, but before we go, Mayor Kev, I see you keep putting on that mask, so we want to kind of showcase that a little bit here. The agate mask.
I'm trying to stay safe, even here in the office. You know, it's with that flash flood, we got caught. You know, I got caught in the rain, and been under the weather. So I'll be opening up my door soon, and I want to make sure that my staff's protected. That's why I keep putting it on.
Thank
Not
you.
only because it's from Agate.
Yeah, I'm surprised it's
I
not
need to
red.
get one of those.
Yeah.
Mail one over.
It'll be delivered.
All right.
Thank you, Mayor.
Sabrina, I want to say something, okay?
Yes.
Okay.
You know, the mayors, the vice mayors don't want to pick a fight here, okay, between us and the senators. And this message is going out to all the senators. Senators, we need your help. We are one people here, and we're not going to start any fight, but you have to understand that we are the ones that touch the people. We are the ones that the people come to for help that are needed in our residence. And all we're doing is standing up for the people, because we have a lot of things that we need to do, and we don't have enough money to do what we need to do. So please, let's work together, okay, and try to serve the people the way we said we were going to serve them. Let's all stick together and do what is right for our people. God bless all of you. And, you know, we're just speaking up for the people that we serve. You guys take care and be safe.
All right, you guys be safe.
Right on. Thank you, mayors. Thank you, Mayor Kenga, Mayor June, Mayor Paco, Mayor Rudy, Mayor Kevin. God bless you guys. Be safe. And,
Thanks,
you know,
guys.
3-day weekend, so go out there and tell your villagers stay home. If they're barbecuing, I want you to go and throw water on the barbecue grill and kick it down. Mayor Kenga, if the young people of Jotnia don't want to listen to you, I want you to tell their dad. And then tealick their ears,
Believe me,
okay?
this was the old school ways, man.
You'll be taking out your belt, I know.
Yeah, but I'd like to thank my staff also, and each and one of the mayors out there for their hard work also.
Right on. Mayor
Keep it up,
June.
guys. We're doing a good job.
You keep it up, guys. Mayor June, if you get a chance this weekend, take a right. Try it out for a change.
Take a laugh, take a laugh.
All right, mayors,
guys.
thank you. There goes
Bye,
your
Mayor
village
Rudy.
mayor.
Yeah, I feel so bad
boy.
for them because they're right. They are on the front line. They're the ones that people call, not just their constituents,
Right.
but the governor, lieutenant
us.
governor, the senate. Yeah, we
Right,
call
yeah.
them all the time. And, you know, it's what a slap in the face. Like, hey, we're going to take this 500,000,
Yeah.
we're going to give it to the 3G.
I feel like over at the
Come
G3
on.
initiative this
They're
morning.
doing these guys are doing everything.
They are. I feel like over at the G3 initiative, they're like flipping the table and throwing the chairs here in this interview. Like, what? You got...
Nobody is against what 3G is standing for, but at the same time, Dale, they just got this money. They just got this recycling revolving fund rules and regs approved. And already, okay, we're going to take the money for that and go use it for this. And just, on top of the fact that these guys are doing everything for COVID, delivering food for Manumco, helping with that, and now with the GDOE TFAP distribution and everything else. It's
Right
just
on.
like, man.
Yeah. Okay, we're going to take a short break. We're coming back. We're going to do a side-by-side. That's Zoom talk for they're going to be side-by-side. The spokesman for the Guam Police Department, Sergeant Paul Tapao, and Major Anton Uggan of the Department of Corrections. That's next. And then we're going to go to California. Here we come. Vince Barraquitagua of Show Your Roll coming in to link up with us at 9:12. It is The Link on the Breeze 93.9. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information
What are the
you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
Hafaday and Mabuhay, I'm Ann Pobutsky. I'm the territorial epidemiologist for Guam. Wearing a face covering protects you and those around you. We know that COVID-19 can be spread by people who are not showing symptoms, which means they are asymptomatic. Because Guam remains at risk for significant community spread or transmission of the virus, it is a necessary precaution to wear a face covering when you are in public. Everyone must wear a face covering when they leave home, have it visible at all times, and put it on when they see others nearby. Face coverings are required for everyone when shopping at stores, seeking healthcare, and inside the workplace. Covering your face reduces the chance that you will unknowingly infect someone else if you are carrying COVID-19 but have no symptoms. Prevention saves lives. For more information, please call 311 or visit our website at dphss.guam.gov.
Beautiful women, how am I supposed to find the one? I've had my share of heartbreaks, I'm just in it for the fun. Yeah, yeah. So ladies, please understand I am a gentleman, but the love you get's the same I give to all your lady friends. Gotta make time for
all right, Alex.
beautiful faces.
Lugwa is drummer. He's one of these guys that I follow on Instagram. He's staying out in
California?
Yeah, California. Thanks. It's called Settle Down. The link, The Breeze, 93.9, 917. Let's go ahead and bring up on the KUAM News Zoom room. We'll do a little side-by-side here. Hopefully you guys won't run into either of these gentlemen over the 3-day weekend. We have Sergeant Paul Tapao, the Guam Police Department, Major Anton Ogden of the Department of Corrections, the 1-2 punch of law enforcement here. Sergeant Tapao, good morning.
Hey, Afide, good morning. Chris and Sabrina, Jason, and all the staff at KUAM. Morning, Major. How you doing, sir?
Good morning, Major. We have Major Anton Ogden of the Department of Corrections. You got to unmute yourself, Major.
Okay, doing good. I'm doing good. Good morning.
Right on. Got to give it up for Major because he's, actually zooming with us from the parking lot at DOC, and it looks like it's hot today. Major, we'll just start with you. I guess, first of all, congratulations. We didn't know because I was so distracted by Senator Amanda Shelton. So she did this Mangafa bill, and it had like 50 million typos in it, and they actually had to do a whole session just so she could red pen her bill, which she didn't even need to do because the governor could have just given away the money. But with all that happening, I didn't even know that they confirmed the DOC director.
Congratulations.
Thank you. Yeah, he is confirmed. The director has been officially confirmed by the legislature.
What's his confirmation name?
Well, we're now calling him director instead of acting director. His official title now is Director of Corrections.
Right on. And so, Major, you guys have had, it's been musical directors over there at the prison. How key is this just from, you're a classified employee, just speaking for the staff to finally have someone in there who, you know, from what it looks like, is going to be there for a little bit?
Well, it brings stability to the organization, knowing that the director is now confirmed and he's going to be around for a little bit longer. You know, when you're acting, you just don't know what's going to happen, right? So again, it's just reassuring now to have him in the position for real.
Let's move on into testing, Mayor. I mean, not Mayor. Oh my goodness, Major. Again, any word yet on the continuation of testing at DSC?
Yes. In fact, we are. Public Health will be visiting our facility today for another site visit. We're looking at testing the Agana detention facility, all the detainees down in Agana, possibly by next week, early next week.
Mm-hmm. How many detainees do you guys have? Well, it's going to change probably next week, right? Because you don't know how many people might get arrested over the weekend.
Yeah, the population the population fluctuates, but usually it'll be around 120 to 130.
Mm-hmm. How many detainees are you
Plus,
guys?
I believe we're going to also test some of this. We have about 120 down there, I think, as of today.
Mm-hmm. What's the max you guys can take in?
Well, we've taken as much as 175. But today we're down in the 120 mark, so we try to keep it around 120 to 130.
Mm-hmm.
Manageable level.
Okay, so next week we're looking at testing the detainees. Anybody else? Staff? Too?
There may be some staff also that are down there that we will test again. I mean, it's been several weeks since we've tested the staff, so I believe some of them down there are going to get retested.
Mm-hmm.
And just do a clean slate, you know, do everything fresh.
But since the last time we spoke, anybody tested positive or anybody came down with symptoms, inmate or staff wise, or detainees?
As far as inmate and detainees, no, nobody is showing any symptoms. However, we have had a staff member recently test positive. He's been out of work for a week or so prior to testing positive. What it was one of his family members that tested positive. So our management told him to stay home, not to come to work, and go ahead and self-quarantine. And he eventually developed some symptoms 4 or 5 days later, and then he tested positive too. So, but he's been away from our facility for maybe more than almost since the 24th, I guess. He's been away from our facility, so we're not, we don't believe that he could have infected any of our staff or inmates because he was already away from the facility
Okay,
prior to him testing positive.
Right. So that's the only officer? That's it?
As of recently, yes, that's the only officer that I'm aware of that has tested positive.
How about we'll move over to Sergeant Tapao. What can you tell us about just the status of GPD positives and any testing efforts that might be underway?
Okay, so to date, we do have 11 confirmed GPD personnel that have actually tested positive with the COVID-19. Now, I believe one of our positive employees is actually recovered and returned back to work. So that's a good thing. You know, we still continue to monitor any clusters that may develop. As you know, last week we reported heavily with our specialized units and everything, you know, with our personnel. Now, moving forward, we were able to adjust accordingly with personnel needs and fulfilling the mission of each respective division or section that was affected with, you know, the absence of some of the personnel. So, you know, nonetheless, we still work in accordance with the mission that's asked of each division, and of course the GPD personnel, whether it be our uniform or civilian support employees. We continue to support our our officers and employees who are home and in isolation and in good spirits. We're hearing good things that they're doing well. So that's a good thing. God bless that. They remain positive and continue to support them. But we continue to monitor, where the areas where we feel where it may be a cluster. And fortunately, since last week or our last report of our last positive, nothing has manifested as of any of the close contact that was identified to the last positive test that was released or that was identified last week. So we're holding ground, and again, the mission still remains the same. We still got to continue to fulfill the mission with the Guam Police Department.
Right, Sarge. We had public health on earlier this morning, and we're talking about these COVID inspections that they do. And there was a church, I think it was Calvary.
Yeah.
Calvary. One of them in Aston, right, where I guess the environmental health, public health inspectors showed up, and they cited them for, not enforcing the mask. They were saying, like, nobody's wearing a mask, no social distancing. How is the Guam Police Department involved in responding to calls like those? Because the public health people had said that, we can go in and, we can cite them, but, environmental health can't necessarily shut down a church. So, again, we're back to that enforcement question. So when the environmental health guys go out on these calls, are they accompanied by the Guam Police Department? And what's the process?
Should the need arise, we do have a task force, 24/7 task force that has been developed. We do have a task force that's assigned to the beaches and the parks. Last week, the governor had allowed the recreational use and wellness of the parks and everything. So we're seeing 100% compliant. We have a task force that's available for that. We work closely with the Guam Visitors Bureau, BSOs, in ensuring that people adhere to that. And, like I said, it's 100% compliant since the governor allowed or lifted the restriction. Now, with our other task force, we do have a response team that will assist for any COVID operations. And we work closely with the Department of Public Health and Social Service in ensuring that these mandates are enforced. They are the regulatory agency that will issue the citation. And, we provide the support should it arise. And, being a 24/7 operation attached to the assisting agencies, or we are the assisting agencies for the Department of Public Health and Social Service. They'll issue the citation, and we'll work with them in gaining full compliance from those that violate either the public nuisance memo or the just pretty much any of the executive orders. So we work closely with them. It's beautiful how we were able to, allow the personnel to focus on the beaches and the parks, and also allow and adjust accordingly to assist public health. And as you saw, when they did that trial run with the funeral services to the quarantine, or the individuals that were in quarantine, to allow them to attend, there was police presence to assure again that they comply with the social distancing, and of course anything associated with the executive order, and maintaining overall health and security within the community.
Okay, so did they get a ticket?
I believe they were cited. The Calvary Baptists were cited, and again, it's going to fall on them, because it just doesn't end there, because now you have the right to operate, and that falls under the I believe Guam revenue and taxation that can actually pull you and work at defunding or defuncting your occupational permit. So this is something that can gravitate into something more. They'll issue the citation. We're alongside that nothing escalates beyond that, and we're there to assure that there's compliance with what's going on with the issuance of the citation for any violation.
Major Anton Uggan, let's if we could touch briefly, and then I'll flip it back to you, Sergeant Tapao, because we're still seeing these drug busts. People getting pulled over, obviously not staying home, but behind bars. Major, are we still seeing? Because we've talked to you, all throughout this. Are people still chucking meth and chewing tobacco and whatever else over the fence at the prison? Yeah, right? Unmute, Major.
Yes, yes, we still have a few incidents of contraband being thrown over our perimeter and attempted to being smuggled into our facility.
Are they getting restless though? I mean, they got no visitors, no incoming. Do you see them? They're getting a little more frustrated these days. And are you guys concerned the longer this continues that it might reach a boiling point?
Yeah, I mean, yes, they're getting frustrated. We've had to stop a lot of activities, even including recreation. They don't even get recreation at this point. No visitation, no incoming, like you said. And, you know, there is some frustration amongst the inmates, but the management is, you know, constant communication with them. And I guess for the most part, so far, most of them understand why we're doing it. Doesn't mean they're happy with it, but they understand what's going on and why.
But you guys have plans in place,
we
right?
just gotta
in the
move
event
forward.
this drags on and they get more frustrated, you guys do have something in place to address this potential, right?
I mean, we got plans to start. Yes, we got plans to start allowing them to do recreation. Again, if we go back to PCOR 3, we will be allowing incoming, like we did last time. But other than that, there's really not much else we can do until we go back to PCOR 4 as far as visitation goes.
Are we worried at all, Major, about, you know, because obviously inhumane conditions at the prison, it's a recurring theme. By not allowing the inmates and detainees to receive things from their family, are we worried that that could be construed as inhumane? I mean, I know we're in a pandemic, but don't you think that by now you guys should have come up with some type of process? I mean, God, Major, it's been months.
About 5-6 months.
Yeah. And so when you talk about the inmates, detainees getting restless, I'm pretty sure that's part of the equation.
Well, okay, so we are providing, the government, DOC is providing cleaning supplies and all the hygiene products that they need. We provide it. That's our responsibility, and we do provide it. We do have limited amounts, so not everybody gets what they want compared to when individual families were dropping off for their loved ones. The cleaning supplies are, you know, distributed on a weekly basis. Inmates are given masks. And the other thing too, Chris, about allowing families out there, the governor has ordered people to stay home. I've got family members that tell me, hey, thank you for not allowing us to bring incoming, because they really don't want to run around the island looking for cleaning supplies so they can give it to their loved one in here. So you want to minimize even the families from having to go out and shop for these items if they don't need to. Some would like to drop it off, others, you know, prefer not to. And so that's just the situation we have to deal with for now.
Yeah, yeah, but I mean, we haven't been in PCOR. We haven't been in PCOR 1 this whole time, though. So have we reinstituted at any point the incoming during the PCOR 3 and PCOR 2 declarations? I know that you guys had a thing where you're like bringing the boxes and then you cut that because of the risk.
Chris, we did have incoming during PCOR 3. Okay. We had a drop-off system. We also had it where postal packages were coming in. Family members were setting parcel packages in with cleaning supplies. I mean, at one point we received over 87 packages. So we were allowing those things to come in. It's only when the governor went to PCOR 1 that we went back to restricting everything.
Any more cell phones?
And again, once...
Any more cell phones found inside?
I believe we found one or two. Yes, I believe we found one or two last week.
Wow. So we still don't know where these cell phones are coming from? We don't know where these cell phones are coming from?
No, the phones are being found in common areas. And we get them and we turn them over to GPD. we don't have the capability of tracing the phone calls or even opening up the phones and doing any kind of searching on any of those items. We confiscate it and we turn it over to GPD. If it's found on a person, then we get them they get charged criminally. If it's found in common areas, we just confiscate it and again turn it over to the Guam Police Department's property evidence and property section.
Let's go back over to Sergeant Tapao. Sarge, we get the Maggies, we see, but just from your perspective, what types of crimes are people getting arrested out there for when we should all be staying home?
And, keeping up with the Maggie reports and my police media release, I found that it's really hard to keep up when we're seeing a lot of drug abuse, and our officers are really hitting it hard with the drug interdiction. And I think it's time where being that it's ironic that we're in September, and September is Substance Abuse Awareness Month to include Suicide Awareness Month, and you guys were able to talk about suicide yesterday on your show, which I thought was really beautiful, because we're seeing that too as a reporting agency with the Guam Police Department, an uptick with aligning ourselves with Guam behavior. But Major Antoine can attest to that the number one intake that they're seeing a lot of is really substance abuse, and primarily the still the prevalent choice of our fellow Guamanians is the crystal methamphetamine, and we're pretty much seeing that on a daily basis, and it's really our officers through their drug interdiction and of course traffic stops that lead and to the discovery of crystal methamphetamine. It's really, you can go a night, you can go through a day, and I guarantee you have at least 6 individuals that either were arrested, either from the northern end to the southern end of the island with possession of crystal methamphetamine. So, we're seeing a rise in that, and whether it be for common, personal use, or somebody with in the intent to distribute because they have a substantial amount. It speaks volumes that it's still there, it's still prevalent amongst our fellow Guamanians who are suffering through addiction. So this is something where we are tracking, and we want to again, street interdiction versus working alongside with the feds. They did seized, I think, 3 pounds of meth, last week.
Yeah.
It's a significant amount. So, it's here. So understanding what we need to do as a community, and there's a lot of factors associated with drug addiction, and Teresa Ariola at Guam Behavior, her team they've been working really hard, and addressing suicide, and of course addressing addiction. And I think Major can, chime in about our guys inundating the intake with people who are found in possession, and it's just, this is something as a whole, as a community, that we need to understand that we're still fighting this battle with drugs. Crime is still being committed amid the pandemic, but again, we still continue to carry out the mission.
Yeah, it's scary, Paul. You just make it sound even so much more scary hearing that, considering the fact we're dealing with an economic crisis, a pandemic, a healthcare crisis over at GMH, a mental health crisis with so many suicides being reported, and we're still dealing, like you said, this drug epidemic. Yeah. And so we asked people this week, are we going to be okay for GPD, DOC, law enforcement side, and the responsibilities that you guys have to handle? Are we going to be okay?
We are. It's tough. There's a lot of challenges. From one agency to the other agency. My brother Kevin was on your show yesterday, and just to hear that the frontliners are what, aside from the things that we have to do, whether it be taking care of a correctional facility, patrolling the streets and assuring safety, or just responding to a sick person. You never know, dealing with COVID. But aside from that, our primary mission is to safeguard the community, regardless of where we are in different agencies that provide safety and security. but the challenges are there, and our guys continue to carry out the mission. And it behooves me if I don't mention that our guys understand what needs to be done, and we're continuing to work, and we're working at recruiting more officers. We continue to work closely in adjusting accordingly to fill the gaps that whether it be retirement or whether it be to resignation.
That sounded like I don't know, but Lord help us.
We're
That's what that
good.
sounded.
We continue to work, and prayers are always good.
I'm praying.
I got the mask on.
We pray for everybody. We work closely with the community abroad, and it's just unfortunate that we still have to face our social ills with crime, and of course dealing with the pandemic. And when you have the two dealings, working with that, it becomes overwhelming at points. But we have coping mechanism. We're working closely with our peer mentorship program. We're working closely with Guam Behavior to assure that the well-being of our officers or our overall GPD personnel is addressed and catered to. So Chief Ignacio was really adamant about pushing out our peer mentorship program. So we have that's available for our personnel within the ranks, and of course to address the needs of our civilian support employees with the Guam Police Department. So understanding what we need to do, this is where we all need to work together as an island and approach this from a holistic standpoint.
Right on. Major Anton, closing statements.
I think he froze.
I don't know how he froze out there in the hot sun. Right. Okay, Major, closing statement.
Well, I mean, again, DOC is still doing all that it can to ensure the safety of the inmates and the staff, and we will continue to do that.
I can see the screen.
Hopefully, we'll get out of this COVID situation soon, but we just got to do what we have to do in the meantime.
Thank
Stay
you.
safe, guys.
Yeah, be safe, guys.
Stay safe.
Wash your hands.
Might be a busy
Enjoy
weekend.
your weekend.
Yeah.
3-day weekend. Please, adhere to the, refrain
Stay
from any
home.
social gathering.
Oh God. Stay home. Can you just put me on the siren of GPD? I want to be the when you guys turn on the siren, like stay home, just like instead of.
You should reach out to Charles Esteves and the tag and ask if we can.
Well, that's even better.
That's good. You're right. Good idea.
Siren, so,
Thank you, Sarge.
You'll be the
all
early
seriousness,
Don't encourage.
it's a 3-day weekend. Let's understand what needs to be done. And I heard the DPHS personnel talking about staying home and everything, and they kept it PG, but I'm still going to keep it in a mature level and ask the community to please do their part, stay home and stay safe, man. It's the best thing we can do to combat COVID, and it's the best way to assure the safety of the community and understanding what we need to do as our civic duty as responsible citizens of this greater island.
Thank you, Sarge. Thank you, Major. Be safe, Major.
Thanks, guys.
Okay.
Thanks, guys.
Hey, we got an announcement out of the office of the Gutnia Mayor. There's going to be a road closure. This is happening Saturday, the 5th of September, 8 a.m. to 5 p.m., and Sunday, September 6th, from 8 a.m. to 5 p.m. It'll be Martyr Street along Bank of Hawaii and Archbishop Street, Flores in Hagåtña/Anigua. Again, that announcement coming from the office of the Mayor of Hagåtña. It is 9:43. We got Bear from Show Your Roll standing by in the K-Wave News Zoom room. But before we get to him, we're going to get to this. Jay, go ahead. The newest episode of the One Micronesia podcast. This is huge. I love this show. Victorious, I was here, stopped by, chatted with him last night. And
No, he was here when I came in this morning.
Yes.
He was still here.
Right. So he's. This is a great show that we're going to debut. I think today, Jay. What can you tell us about this latest episode?
Yeah, actually, Vic. I mean, this was truly like a labor of love because, like, for those of you whose lives and spirit that Ed Wengu, the late Ed Wengu, touched and everything like that. I mean, the man was truly like a saint walking among us and everything. You meet this guy and, like he's the most personable guy, gives you a firm handshake, lets you know that, he's humble, but he cares about you and everything like that. And then, just by his actions, by his tireless service to the community, to reaching out to his fellow FSM citizens who now make Guam their home. And he's like, hey, this is our home now. We have to be productive members of society. Let's be together. Let's share in our, our Pacific heritage. Let's all work together. And Ed tragically is no longer with us. He left a couple weeks ago. I mean, we mentioned it when the news was breaking on this very show. I mean, we're all so shocked by it. And Vic, because of the host of the One Micronesia podcast, went out and interviewed like so many people. And this is just a small snippet.
It's a little Chessa, morning Chessa, if you will.
But even the people that we interviewed, and we interviewed a lot, just a tiny fraction of the lives that Ed touched in positive ways. And, he just will forever be in his debt for, just the amazing things that he did for his community in that small time that he was allowed, to do his work on Earth. Great guy, amazing.
And what great work. I remember when I first met Ed, we were trying to get the word out about a lot of the outreaches that were going on in the Hemilani apartments and with the FSM communities. And I remember I got his number from Vic, and the first call I had with him, I was like, man, just give me an idea. What are some of the things you do, with these outreaches? And it was like an hour of him just explaining all the different things they do. So this guy was just definitely embedded in the community, definitely waking up every morning with that driving force of how can I make this island better, not just for members of the FSM community, but for members of all the communities on Guam. And so
we really hope that tonight on KUAM that you'll be able to watch this special tribute that Vic put together tonight, 6:30 p.m. On KUAM TV8, and of course it'll be streaming live on our KUAM Facebook page, and then we will also play it again tomorrow, Saturday,
tomorrow 10 a.m.
10 o'clock in the morning. And again, it's a tribute to Edmund Wengu.
Work could be very stressful, but with just working with him, he would make it he would make it like fun.
He gives not only 100%, he can go above and beyond the effort he brings to his work. He'll do 100 and he'll give you 150%.
Sacrifice was the biggest thing I'd see from Ed. Every time we'd come into the office, he'd be the first one there, but he'd also be the first one out to a meeting. Come back from one meeting, another meeting comes up, he's out. Come back in, come out. Most people, they're just like, oh, I gotta reschedule this meeting. Ed wanted to make sure it got done. Like, if he believed that if it was gonna be possible, he would have to sacrifice a whole lot, and that whole lot came from him. Just his physical being, his spiritual being, his whole mindset, and that was his work ethic, man. That's what kind of pushed the whole team to believe in what Edmund was trying to do, his vision of just trying to make a better Micronesia.
I always told him, I was like, bro, you're special, like you're gonna do a lot of things in the future. Just tough, man, because he has such a bright future, and he just had that personality that he could just adapt in any situation that he was in, and he could just vibe really well with everybody. It could be someone from Guam, from Chuk, from different ethnicities, and you were always comfortable with him, and just hanging out was easy, and he was able to bring people together, and he made hanging out together easy.
But that guy just never stopped trying, never stopped caring, and no matter what success he had, he remained humble. I think there's a lot of us that just need that lesson in humility and service, and don't just stand behind a polarizing political stance and say, I'm good because this is what I believe in and you're wrong and whatever. It's working together, and it's dialogue, and it's truly being there for each other. That's what community is about. And I think if one thing I learned from Ed, he was probably 20 years younger than me or so, but I learned a lot from him.
Ed was always coming up with ideas. Ed was always writing things down, and he always understood, the importance of our work and our partnership.
And so Ed played like an essential and like crucial part in doing that. So in kind of the reorganizing of the organization, we had gone through this course that was like a nonprofit improvement plan. And so, for 10 weeks we met, and me, him, and another program manager met, every week to kind of discuss, how we were going to build the organization to really combine all of the services that we put together. I want to say that Ed also, kind of, he helped us put together, our vision for the organization, which is a community of diverse cultures thriving together towards success. So, he was just such a big part of wanting to empower the community in all different kinds of ways. He helped us put together, the Micronesian Youth Forum. So we had that for the first year last year. And so with a partnership with GPD, they had kind of reached out to us, and saying like, how do we kind of talk to the kids about this? How do we reach them? And so, through discussions, he really kind of ran with the Micronesian Youth Forum and put it together, kind of organizing all of the different guests that we were going to be having, different breakout sessions, the panel discussions. He also, over the past 2 years, the office has really grown and thrived and been able to help more and more people. And that's through Ed's partnerships that he's been able to, kind of harness during his time as project director. The team always knew that if they were having a problem at like any sort of agency where there was a miscommunication, they could go to Ed and he would be able to, go to the right channels and like talk to people and say, hey, like this is actually, this is what the law actually says. So like you are required to, accept this document or things like that, and he's just always been, a cheerleader for the organization, a cheerleader for the community. Like just all of the amazing things that he's done. It's truly inspiring. Our organization does so much, and Ed was always there to kind of go to any of the events that we had. Sometimes we have last minute things and Ed was like, okay, no one else can go, like I'm there. And I'm like, okay, great. Like he was just always like ready to go, and he was always ready to like find volunteers because he wanted to get the FAS community involved. He wanted to have them coming out to volunteer. So he brought on a bunch of steady volunteers, and eventually some of them became employees when we had positions open up, and it was because Ed saw their potential, saw that these people, they can make a difference in our community, they can become role models for our community. Like let's reach out to those people and get them in.
Little preview of what you can expect tonight with Vince Fallon's One Micronesia show that's airing tonight, and it's dedicated to give tribute to Edmund Wengu, who passed away after not making it through surgery that he had. He passed away in February, and we're doing a tribute to him and his life and the people's lives that he touched tonight. KUAM TV8 at 6:30 p.m. It'll be streaming live on Facebook, and then, of course, we will share it again tomorrow at 10 o'clock in the morning.
Right.
And this is in partnership with Manyetlu, and that was Sam.
Yeah.
Sam from Manyetlu.
Yeah. And I mean, I can't, again, it's what a tremendous loss. And I think where Ed was so valuable is if you go into these, and a lot of it's socioeconomic, things, anybody who grew up poor or disadvantaged, facing similar issues, and especially with the youth, growing up in these homes where the father's not present. I think what's so key is for these youth to know that there are people out there who care about them. And Ed was one of those guys who showed these kids that day in, day out, all day, all night. They knew that when they saw him, here's somebody who gives a damn about their life and where it's going. And we were just talking while this thing was playing, sometimes God takes people to inspire us to be like them after they're gone. And we're praying that's what's happening with Ed's loss. So that being said, let's move to the KUAM News Zoom room. It's 9:53. We are going to go to California, where Bear is standing by. You're not in jail, right?
Not in jail. No, not in jail, Chris.
Say, wow, how did we get this?
I know, because I was like, dude, it kind of looks like he's in jail.
What a way to start an
I'm
interview.
just
What an
saying,
intro.
You want me to like smack him?
Nah,
I can do that. I
it's
can
cool.
do that.
That can be arranged.
I mean, well, welcome to the show, Bear. So you're in California, right?
Yeah, I'm in California. Thank you for having me, guys.
Of course, we're so honored and glad to have you. Now, Bears, man, this guy I don't even know how to describe him, but he's just got his hand in so many different things. Iconic. I mean, he's one of the first guys to put Guam clothing brands on the map, so to speak, with a show you roll. I mean,
I did a story when you were last on Guam, and one of the things I said in the story was you are what is it? Jordan's art of basketball, as show your role is to jiu-jitsu.
Right. Yeah.
Thank you for the kind comments. We prefer to refer to ourselves as the Zorits are to the local Chamorro kids, or the local kids. So thank you for that.
So we wanted to bring you on because the show it's the link, and we linked up with one of our former reporters last week, Drew Murphy. He's living in Hawaii, just to catch up with him, and so we wanted to catch up with you and how are things going with you and in California under this new COVID way of life.
Yeah.
I think we're okay for the most part. I mean, I think we're good. I think California has kind of had its wave about like a few months ago. We were kind of like at the top, but like alongside New York, and then I think a few other places. But now it seems like it's a little bit more mellow. It's starting to die down. Of course, it's still a lot different than it was, but overall, the state I think is starting to make that slow turn on the way back up. But yeah, I think we're blessed and we're fortunate. There's a lot more people out there that have stuff a lot worse. So we're super blessed and fortunate. So
Bear, if you could just tell us exactly where you're at, and then if there are and were there and what types of restrictions in place for the COVID.
Well, I live kind of like in the Seal Beach, Orange County area. So we're kind of at the break towards like the Orange County side. So that's kind of where we get a little bit of the Orange County ordinance, but my office and the headquarters is located in like Signal Hill, which is basically Long Beach, and that's LA County. So LA County is a little bit more strict in terms of what you can and can't do, and Orange County is a little bit more loose in terms of what you can and can't do. So schools are starting to come on online again. They're doing like a lot of the online school for kids and my kids and all the other kids around. And then restaurants are opening up a lot more. Outdoor dining is the standard now. Freeways are starting to become traffic starting to pick up because people are getting back to work again. So I think it's like if I had to like rate it from a percentage standpoint, I would say probably we're at like 60% maybe of what we were, kind of getting closer to 70. But it's definitely not like 30 or 40% like what it was like 3 months ago or 2 months ago. So.
Do you have to wear a mask when you go around over there?
Yeah, mask for sure. That's like the new standard, the new norm. I think that's kind of like the new thing now. You can't go into businesses and places without a mask. So, but everyone's out there now. It just seems like more people are out. Beaches are packed now. Things are kind of making their turn back. Before, like 2 months ago, it wasn't like that so much. It was like maybe half of that, and then a month before that, there was like it was kind of like a ghost town. But it seems like things are starting to kind of make the turn. So.
Have you had a chance to talk to any of your friends and family over here on Guam? If you've given them any.
Yeah, for sure. I'm on multiple chats with a bunch of friends from Guam and things. So I'm consistently kind of getting somewhat of the temperature of kind of what's happening locally, and I'm in tune to some capacity on what's happening, but of course not like I'm living there, so I don't really know exactly what's happening. But yeah, I kind of got a little bit of what's happening over there, but you guys probably know way more than I do. So.
Right, man, Bear, I don't want to put you on a tough spot, but I got to ask because this question came in on the WhatsApp. What can you tell us about Three Chiefs Brewery?
Three Chiefs Brewery, man. No, I mean, it's a passion and it's a work of love, So, we're still building Three Chiefs and kind of like getting ready for the new wave of what it's going to be after this new interesting time that we're in, But no, I think the best is yet to be seen for that brand and that kind of like project that we've been working on for a while. So I think probably going into the fourth quarter of this year, maybe when it starts to simmer down a little bit with this whole like COVID thing, probably first quarter of next year, we'll start to make things interesting again and start to kind of get back on the horse and start pushing. So
Are we looking at any like COVID themed drops from Three Chiefs, like maybe a coronavirus sour or the COVID-19 IPA?
yeah, for sure. We're gonna start making some masks and you put a hole in it so you can drink from a straw.
I need 2 holes.
We'll try and think of something creative.
Right.
Who knows?
Barry, and you talk about where you're at, and people are the freeways, the people are starting to go out there, the beaches. Is there that thought maybe with yourself or just the community about that second surge or that third surge? Because we saw it here on Guam where we were looking at zeros and ones, and then we did a reopening. A lot of people were critical and said it was too much, too fast, and now we're kind of dealing with the repercussions of that reopening as we're on a lockdown. We're on an extended lockdown. The numbers are crazy. So you see it across the states, right? Where people...
I want to say we're kind of, I'm not sure if we're in the second or the third wave here in California. In all honesty, it feels like we're on the third one,
right.
Or we're kind of deep in the second one. But in all honesty, I mean, I think a lot of people are getting really sick and dying from this stuff. So people are taking it really serious, and people are just trying to do their due diligence to be respectful and mindful of people that are maybe a little bit more exposed, So it seems at least like over here, a majority of people, once again, I'm in California, I'm not in another state where maybe as a whole they have a different view. But at least here, it seems like everyone's trying to do their best to, wear a mask and, do the whole social distancing and
right.
And following whatever the governor or the governor of the says. But of course, with businesses, it's a little tougher, and a lot of businesses are in really tough positions, and people are losing jobs. And I want to say, last night I heard that the rent. I think it was like the rent ordinance where you can't kick out anybody that lives or that's renting kind of got extended to the end of December, if I'm not mistaken. So, so yeah, there's a bunch of things going on, but it does seem like there's at least like a standard to where people are being able to live in this new kind of like era that we're in per se. So,
as a businessman, Bear, have you seen any impact at all to the businesses that you run?
I think probably like anybody, we're not one of those like thriving industries that happens within times like this. So we're kind of like a luxury based product, and a lot of our product is based off of people being in the gym, so more people that are in gyms and using uniforms and stuff, that normally helps our business. But all gyms right now are closed, and I'm not sure what month we're even going on, if it's like month 4 or month 3 or month 5, you kind of forget.
Wow.
So I think traffic wise, I think we've been down a little bit. Luckily enough, our sales have still been great, and we're in a good position. So we're super duper fortunate there. Like I said earlier, there's businesses like restaurants and gyms and, other places that are like literally on probably their last breath. And I can only imagine how hard it is for them to kind of adapt in these new times, to be creative with some of these new restrictions that the state is giving them to be able to operate. So yeah, we're okay, man. We're super blessed, and I can't complain. So.
All right. Well, Bear, we really wanted to just bring you on just to check in with you and see how you're doing. Was there any, shout outs that you wanted to make to anybody here on Guam while we have you on the line?
We only have a little bit of time, Bear, because I know if you're going to do shout outs to Guam, you know how it is. You shout out one, it's like 2 hours later, Auntie Pie, shout out to Auntie Pie and Mong Mong.
No, man, no. I just thanks for having me on, guys, and thank you very much for the time, and thank you for keeping everybody around the world connected and keeping us informed for the people that are not in audience. So I appreciate the time.
Right on.
All right, appreciate you.
Yeah, thank you, Bear. And at 600 Harmon Loop Road, Dedido, Guam 96929. Make sure you put a lot of little popcorn in there so the bottles don't. If anything.
I got that one. I picked that one up. I get what you're laying down.
Right on, man. Little subtle, Hey, thank you, Bear. Be safe, okay? Wash your hands.
Thanks, Bear.
Thank you. Have a good one.
Okay,
Ciao.
so there
Guys.
you go.
So.
Cool guy, 1004. That's Bear, Vince Bear, Kittigwa. Yeah, shout out to his mother-in-law, Agnes, over the legislature, was texting me. While she's like, hey, my son-in-law is coming on your show. So,
yeah, really humble guy. Really,
yeah.
really humble.
let's go ahead and we got to wrap. It's 10:04
Yeah.
Friday. Bree, some of the takeaways this morning.
The mayors, don't mess with their money.
Yeah, they're pissed about that G3. I mean, I was waiting for one to pop up and be like, no, give them more money. But no, nobody said that.
Crystal, Paco, San Augustine, you heard there's going to be a press conference at 11 o'clock. It's the stay-at-home order, PCOR 1, will be extended to 9/11. That's September 11th. That's next week, Friday, 12 noon. 49 people are hospitalized at the Guam Memorial Hospital. 12 of them are in the intensive care unit, and 10 are on ventilators. The press conference is at 11 o'clock. The governor will be there, Lieutenant Governor, Public Health Art San Augustine, GMH Administrator Lillian Posadas, and of course Dr. Felix Cabrera will be on, and he'll be doing a presentation.
I think one of the key interviews we had this morning is we've always made a habit of getting Dr. Peter Lombard on. He's he calls himself an amateur statistician, but he's been crunching these COVID stats for the duration of this pandemic on Guam. And his comments, his interview this morning,
Left you a little shook, right?
left me a little shook because, I mean, he's kind of been really reasonable, and I trust his perspective because he's not like a whacked out right winger. He's not a whacked out left winger. He kind of just puts it right down the middle. And this morning, his right down the middle was that we're going to see more fatalities. If you track the stats of who has COVID, a lot of the elderly have it, and the percentages of the number of people who get hospitalized, the number of people who die. And coming from him, it was just...
Right
and it was,
at the beginning of the show, too.
right. I mean, it just set the tone, and after that, I was like, oh, where do we go from here?
We also have a development, guys, because Nestor actually, he is, of course, he's working from home. He's doing the safe thing on our news team. He has actually secured a Zoom interview with Jonathan Bartlett.
Oh, yes, okay.
Who was the gentleman who brokered that deal that actually brought more medical resources, albeit temporarily, to the Guam Memorial Hospital. And Mr. Bartlett actually was corresponding with me, and he goes, yeah, I can join you guys from a plane on Wi-Fi. So as a nerd, I can't wait to do that Zoom call. I want to make that happen.
Jonathan Bartlett, he is with the Health and Human Services Agency, so he is with basically the representative for FEMA, I would think. And he's on Guam, or he should be on Guam, because he's going to be overseeing this whole deployment of medical support from the military that FEMA approved over the weekend. So they're now all here. There's a contingent of nurses, critical care nurses, intensivists, and respiratory therapists. And so Crystal mentioned that earlier, and we've been talking about this all this week, that they're here to help support the Guam Memorial Hospital, but they're only here for 30 days.
Right.
And so the onus is on the government to show FEMA that we are actively recruiting for much needed medical support.
I hate it when you say that. The onus is on the government. Never ends well. But anyway, let's be positive, guys.
It is what it is. That's what it is. And
I also don't like it when you say that.
Yeah, I didn't say it first.
I know. But Dr. Lombard said it first this morning. And when Dr. Lombard is dropping it is what it is, yeah, you better stay home. 10:08. Good job today, Sabrina.
Good job, Chris.
Good job, Joe, sir. Jason Solis, Ken Sanity, Ken Janier, Master Control, and last but not least, as you can see, our KUAM News team, we got your six and already working hard to get you in touch with the people that you need to hear from.
Please, please, please stay home this weekend. Be safe, or not even just this weekend, but for the next week under this lockdown.
Yeah. And remember, we'll be getting you that press conference on the KUAM News Facebook page. Probably end up popping it up here on the radio, too. That's at 11. But remember, with these government press conferences, when they say 11, they mean it loosely. Okay, and that's an understatement. My name is Chris. Esta. Adios.
Bye.